of the CSR Health Impact Summit, an initiative of the Integrated Health and Wellbeing Council, the IHW Council. I'm your host for the evening. My name is Anisha Nair Thaban. I would like to thank you all for taking the time out for joining us this evening. Tonight, we will recognize, appreciate, and award all those companies that are using their annual CSR spending to create a health movement, undertaking projects to improve health and well-being of communities and making health of the nation their goal. The IHW Council, the Integrated Health and Wellbeing Council, is a not-for-profit organization working towards creating awareness and advocacy around health and well-being with multi-sectoral engagements and actions in line with the UN Global Agenda of Holistic Approach to Sustainable Development Goals. The healthcare delivery has traditionally been considered the preserve of the government or of private companies that charge a fee. But the IHW Council believes that good health is a shared responsibility for a healthier, happier world. Along with government agencies and private players, many companies are working shoulder to shoulder to improve healthcare outcomes in the country. Through the CSR Health Impact Awards, we at IHW Council aim to create awareness around the significance of good health and environment and also inspire others to include these concerns in their CSR models, thus encouraging conscious efforts towards achieving a better and improved world for our future generations. The COVID-19 pandemic has had a devastating impact on societies and communities across India over the last 2 years. The socioeconomic landscape too has been disrupted, wiping out several years of development gains that were achieved in line with the UN 2030 Sustainable Development Goals. It is important to note that in these ever-changing times, the outlook towards CSR has evolved and continues to evolve. One of the key parameters for this change is the idea of collaboration in bringing about a more sustainable change through corporate activities. The collaborative sustainable responsibility will not only motivate organizations to pool talent, but also address some of the important areas such as complex industry threats, motivating employees, and recognizing new business opportunities, to name a few. In our opening session of the evening today, we will try to understand the transition that is currently underway and how this will shape both businesses and business leaders in the post-COVID-19 world. Now, for this session, I would like to request our speakers to please come on stage. I would like to invite first the moderator, Mr. Kamal Narayan, CEO of the Integrated Health and Wellbeing Council, to please come on stage. Please put your hands together and welcome Kamal on stage. He's a New Delhi-based entrepreneur and the head of the IHW Council, which is the premier think tank. He brings together approximately 2 decades of professional experience working as a journalist and a health communicator. He began his career as a journalist with the leading English newspaper Hindustan Times and the Financial Chronicle, and went on to work with premium wire agencies UNI and PTI. And now, of course, he's the one who leads the IHW Council. Please also welcome our other speakers who are joining us today. We have a mix of some speakers joining us virtually. So please welcome Mr. Ram Bandyopadhyay, former Secretary, Ministry of Corporate Affairs, Government of India. Please put your hands together and give him a round of applause and welcome. Mr. Bandyopadhyay is an IAS officer, the 1974 batch, and he retired as Secretary, Ministry of Corporate Affairs, Government of India in 2011. During his career, he has been associated with the Central Administrative Tribunal, CAT, Department of Public Enterprises, DPE, Ministry of Telecommunications, Planning Commission, Ministry of Steel, Ministry of Industry, International Center for Promotion of Enterprises, and the Institute of Public Enterprises, Hyderabad. And he is joining us virtually. Please also welcome Mr. Alok Ranjan, IAS, former Chief Secretary, Government of Uttar Pradesh. Mr. Alok Ranjan is a retired 1978 batch IAS officer from the UP cadre. He retired on 1st July 2016 after holding the office of Chief Secretary of the Government of Uttar Pradesh, and he was appointed as the Chief Advisor the Chief Minister of Uttar Pradesh and the Chairman of UPSIDC as well. So please put your hands together and welcome Mr. Alok Ranjan. Please welcome Mr. Matthew Cherian, Board Chairperson, Care India. Please welcome Mr. Cherian on stage. He's with us and is joining us in person today. Mr. Matthew Cherian has worked in the area of rural development and cooperatives in association with the National Dairy Development Board. He has also served as the director of Oxfam India, the member of NGO Task Force in Niti Aayog, member of Policy Committee in the Ministry of Social Empowerment and Justice, member of the Core Committee of National Human Rights Commission. And please also now welcome on stage Dr. Ranjana Kumari, Director, CSR India. Please put your hands together and welcome on stage Dr. Ranjana Kumari. Dr. Ranjana Kumari is a renowned academician and a social activist, currently serving as the director of the Center for Social Research in Delhi, as well as the chairperson of Women Power Connect, a national level organization of women's groups. She has dedicated her life to empowering women across South Asia and has authored many well-known publications. You would have seen her on television as well. So please put your hands together and welcome all our speakers who are joining us virtually as well on stage. And I'm going to hand it over to Kamal to take the proceedings further.
Thank you, Anisa. Good afternoon, everyone. It's such a pleasure to be here with all of you. This is another, the second physical program we could do over the last 2.5 years. And the greater pleasure for me is that I'm today sitting with and, kind of getting a chance to interact with people who have the experience in public service almost more than my entire age. So that's a really a great honor for me. So thank you so much, Dr. Ranjana Kumari ji and Mr. Cherian, and also our speakers who are joining online. Are we getting our Mr. Ram Bandyopadhyay and Mr. Alok Ranjan? Okay, so I think they must be connecting.
No, we are here.
Let me begin. I'll be starting Ranjana ji with you because I think that's how we should go, women first. And the same thing is, I think Mr. Cherian also believe and is, I think, passionately working in that area that the women of our country get good health in all possible manner. So, our anchor Anisa was, mentioning that the COVID-19 has disrupted life like never before. We all have seen it. We all have experienced it. And everyone, I think, in our country have experienced a different level and a different, intensity. It definitely had impacted our life and affected it like never before. And I'm sure has changed the way of life we see now. But at the same time, I think India has always been seeing so many pandemics and epidemics and so on and so forth. Just to give some numbers, maybe, and all of you are, very well aware of it. Just the bad air killed almost 27 lakh people in the year 2020 in India. 27 lakh people were killed just by the bad air. If we see COVID-19, the overall numbers, the official figure says that 5,23,000 people died because of COVID in India. But the air alone killed 27. Nearly 7.5 lakh children die before they complete or their parents celebrate their 5th birthday. This is happening in our country almost every year. And we are obviously making a lot of progress. We have reduced these numbers substantially, but 7,50,000 is too much and too many. So, and that too every year. Almost 30,000 women die during the childbirth in our country almost every year. 30,000 every year. So India has, I think, been seeing a lot of these health challenges and challenges to the lives. For that matter, TB, our country is gearing up to, our Prime Minister declared to achieve the objective of TB-free India by 2025, which is killing almost 4 lakh people in our country every year. So in this scenario, when you see so many health challenges are crippling life, and we all look up to the government to, kind of come up with a stronger healthcare system, accessible, affordable care, reaching to everyone, equitable care. But I believe in a country of our size, definitely uh, government alone may not be able to make all the difference. And we have seen that during the COVID-19 time. None of us, or many of us, and many will be, kind of, their work will be celebrated to, this evening. They did not sit back and thought that the government will come and rescue. Many of them, people came, by their own, they volunteered to help the society, the communities around. We have seen, wonderful stories around that. So in this scenario, something more structured like CSR, which we consider corporate social responsibility, has roots in, I think the practice of corporate philanthropy, charity, but at the same time, over the period, became an important contributor to the people's health and welfare and empowerment. So, Ranjana ji, you have been championing the cause of women empowerment for so long, almost, I think, maybe 40 years now. Your organization resembles the name of CSR. So it's corporate social responsibility, but she has been running an institution called, Center for Social Research. So, Ranjana ji, how do you see that the CSR component, which initiated as a charity, become, one of the major component in terms of, reaching out, helping to the communities, and the government recognized it, brought a CSR law. And today we have seen a remarkable, spending happening under that. How do you see, and I have mentioned some of the numbers, the challenges to the women, especially since you work in the women empowerment space, are pretty evident. How do you see that CSR as a component has been able to make certain difference, and where do you see that it can further help us, especially the, the realization which we have got post COVID-19 time?
So, first of all, thank you very much for giving me this opportunity to also talk to, and perhaps I would like to meet also of the people who were part of the award. And as a jury, I saw a lot of excellent work done by a lot of you in the area that you have been working. So really, this was a kind of eye-opener, in spite of the fact that you are saying that I've been working for so many years for women's empowerment issues. What is very important to understand that no nation or no city, no block, no village will remain healthy, or you can look for the future of that particular area and people to say that this is the most healthy part of our country, unless women and children are healthy there. The biggest challenge is that when you say health for all, it is not health for all. It is not health for women, and it is not health for children. That, what am I saying? I'm saying that every health indicator or every health report which considers health indicator, India comes at the bottom 10, bottom 20. Why? Because India has a very high maternal mortality rate. There's a high level of anemia among the women. The infant mortality rate has shifted by 0.6%. by the National Family Health Survey report 5, which has just been recently released. These are official data. So, and also that you have to see that this pandemic really shook us up, and our realization that if our women are not healthy, families have really got devastated, because who will look after the sick elderly parents, husband, children, if she herself is not strong enough and she herself falls sick, and many became very, very unhealthy. So that's the story from the side of the women. Now here are the health providers who really were very actively involved during the pandemic. It was not only in Delhi, perhaps I don't know how many of your family, God forbid that anybody was sick, but we were all very sick. And the woman who brought the medicines, which were directed by the centralized system of delivery of medicine, were the ASHA workers. They didn't have any protective kits. They had no training, and they were not even looked after as far as their own mental health is concerned. In Delhi, in Haryana, we worked in many districts and started responding to that whole challenge. And slowly, of course, a lot of CSR work went to equip them with safety kit, with, telling them what sexual harassment at workplace and at that time means in such an emergency, and how domestic violence increased. You were already with the abusers, some, not all the families, some families. And then when you are such a long time confined together, the violence, domestic violence increase. And we all know the data really speaks volumes about what was happening, and no support system. At least in normal circumstances, you can go to report to an NGO, some women's organization, some friends, you can go to a police station. That was that time that even those services were not available. So more suffering for women. And ASHA Anganwadi workers were not equipped enough. I think they are our foot soldiers. They are the first health providers in the rural context. Urban areas, we do not know how much. And secondly, accessible and affordable. I think that's a dream. Have you visited any hospital in the recent times? Affordability and accessibility during the pandemic was absolutely one, what do you call this, just a ambulance to be taken from Gurgaon, Ansal Plaza, this one sector to Delhi, spinal injury cost 55,000 rupees. And we paid it. So you can imagine the accessibility. That means what? That means what? That if we are not prepared and we are not going to really equip ourselves, I'm not only putting a huge disaster picture in front of you, but we were in disaster. So what should the reset look like? The health reset should look like women's health as a prioritized area of investment. Start investing in women's health. If you will not do it, and as a nation, if we will not do it, as a people, I don't care for what the reports where they will put us, but as a nation, will not be able to really able to protect the health of the nation, of children. So I think prioritize women's health. Look at, nobody talked about menstruation. Teenage girls' health during that period. Teenage girls' health has become like a huge challenge, and we all have faced it and worked for it. So I know as a personal first-hand information that these are the areas where you have to look at women's health, girls' health, children's health first, prioritize that. And of course, there'll be no time when we will start getting health for all. But if you ignore women's health, look at I don't know how many of you are consulting this National Family Health Survey, but wherever you look at and also the other challenge, there are three major trends that happen. I think I'm taking too much time, but I just want to conclude here. Three major trends. Girls have dropped out of the school. So you have a large number of areas where you go to villages and visit them, kasbas when you go to, smaller city towns when you go to, girls are re-entry of girls into the school. Otherwise, they're getting married. They're either preparing to get married, they've already got marriage, and underage marriages have increased. Marginal difference. Even when you look at the National Family Health Survey, it is dropped by just 3%, 26% from 23 to 26%. That's what has happened. And this is old data. So this is not a data after. So COVID reset, start investing in putting the girls back into the school. Start putting, holding the district education officers accountable for it, and start investing in their health. So I would so far say this much, and then maybe if you
Thank you so much. At this point, Mr. Bandyopadhyay, the challenges have been manifold. They have become even, I think, harsher in the last 2 years of COVID-19. But as I said, the India has always been kind of a victim of maybe many pandemics and epidemics, which has been raising, in our country all across all the time. You had taken a very important lead during your time in the Ministry of Corporate Affairs, and came up something so innovative at that time. And I was hearing Mr. Cherian also in one of the kind of his talk, appreciating that the voluntary guidelines which came up in 2009, and you have been a very strong advocate of why CSR should not be considered just as charity. How much we have actually progressed from there? The 2009, which was then followed up with your another important, I think the seeds were sown by you for the company law amendment, which came in form of the mandatory CSR spending requirement. How do you see where all we have moved from there now, and is the CSR still continue to be more of a philanthropy or a charity, or we are really moving towards the more of a collaborative sustainability responsibility?
Thank you very much. Yeah, this is something very close to my heart, the CSR and how the CSR has evolved over the time. Am I audible?
Yes, absolutely, sir.
Okay, thank you. So now, as you were saying, in 2009, when we are running the Corporate Affairs Ministry, you see, basically we had taken two mottos. One motto was that the corporate growth with enlightened regulations. This was motto number one. What do you mean by the enlightened regulations? The corporate growth will be there. The country deserves, country wants corporate growth, but it should be with the enlightened regulations. Whatever regulations the government or the other paragovernmental bodies will form, like SEBI and others, that should be done after a lot of discussions, taking the views of all stakeholders. That should work. So this is number one. And number two was corporate sector with inclusive growth. And the CSR that we are talking about today is actually the product of that motto, that corporate sector will grow. But what type of growth we expect in a country like ours, where there is still abject poverty? The corporate should also have the inclusive growth. Now, I just want to clarify a little bit. The law was simultaneously under preparations. The Company Act, which has become now Company Act 2013. The original Company Act, which was put up there are many variations, but 2009, there was no mentions of the CSR. You can find it out. The bill that was put up before the parliament there was no mention of CSR. In the meantime, what we did is we held a massive meeting at the Vigyan Bhavan Plenary Hall, where the CII, ASSOCHAM, FICCI, all the organizations were present, and different other organizations like the Chartered Accountants of India, the cost accountants, the company secretaries, and many of the universities, the IIMs and others, they are all invited. So there, in presence of the President of India, we sort of launched that voluntary guidelines for the CSR. There was also another voluntary guidelines that was set, the corporate governance. So both these voluntary guidelines were launched simultaneously. Our approach was that it should be voluntary. Why? We wanted the board members to be sensitized. Believe me, in our service, Mr. Alok Ranjan will bear with me, we come across with different types of people. Sometimes we often blame the corporates or the very rich people. But I have seen myself that some of them don't have any idea how the villages look like, what type of problems the villages faces. Just like Ms. Ranjana Kumari was mentioning about, what was the problem in the rural villages. Believe me, there are many persons in the corporate world who even don't know anything about it. So my basic idea was at that point of time to sensitize the board members, to make a body there so that they will look into the problems, and whatever they decide, voluntarily they will try to do something. At 2% they should spend, but there was no upper limit. Like, for example, I don't want to mention the name of some companies who are already spending more than 2%. So this was the basic idea. And I was telling simultaneously, the law, the clause by clause discussions was being held. Parliamentary committee was doing these things, and we were going there as giving evidence before them or explaining them the clause by clause. So the chairman, again, I don't want to mention the name, but it should be clarified to all that the chairman of the committee, who is now the present day very important leader of the present group, so he told me during the lunchtime that, Mr. Bandyopadhyay, you have already published the voluntary guidelines. Why don't you put it in the law? And I explained to him why we wanted to keep it in the voluntary guideline, because we wanted to give 5 years time to the corporate world, let them evolve. And after that, if the government wants, they can put it, they can mandate. He told me, and that is why I have the tremendous regards for the politicians also. Sometimes we miss the point. He told me during the lunchtime that, Mr. Bandyopadhyay, after 5 years, where I will be, where you will be, nobody knows. This is the time. If you put it in the act, we will pass it. I came back and I told the minister, explained to him. He told, yes, we agree. Then we put it in that law, in the draft bill, and which later on become the Corporate Bill 2011, and then later on in 12 it was passed in the Lok Sabha, and 13 it was passed in the Rajya Sabha. That is how the Company Act of 2013 was passed. So this is the mandating of this thing. But coming back to your more fundamental problem, you see, this corporate, the CSR, as you said, I mean, why it is not a charity, it is a win-win situation. You see, charity is something from your own pocket. You give the money and do this. If the government wants the money from the corporate sector, they can raise the tax by 2%. They will get the same money. It is the willingness of the people. They should understand. They should be sensitized. They should do something. They should innovate. One more thing, I should not miss this opportunity to tell you that we had another idea, that it may not be in cash only. It may be in kind. For example, as you all know, that the government spends a lot of money in rural development. There are lots, plenty of money. The crores of rupees are going to the villages and others. But there are no good engineers to make any plan, to have even a properly culvert made, or a small bridge made. But there are companies where they have many engineers. They can go there in Saturday, Sunday. They have plenty of time. So in the neighboring area, these engineers can go and they can help them. And that is how it will be a win-win situation. The government money will be properly utilized, and the company will also get the benefit that company is helping them. So many companies have the doctors also. Many companies have their own hospitals. Their doctors' free times, and sometimes voluntarily, they can go around the villages and help them. This is also a CSR. It is not the money. Now people find that catchy thing, money, 2% of the profit, so they go by that thing. It is not only that. Many educated people are there. They can contribute in different ways. As you are telling, I mean, because our basic objective is what? To raise the livelihood, to raise the common people up to certain standard. It is not only the medicine. It is also they have to know how to use the medicine, how to use the proper drinking water, what to do, what not to do. The good practices, health practices are equally important, if not more, than the medicines. So those things have to be told also. So I think I should stop here now. But if
Thank
you
you so
have
much,
other questions, we'll talk.
Mr. Bandyopadhyay. Actually, I'm sure you would be really happy. The seeds which you sown are actually yielding a lot of fruit now. The kind of, I think, volume we are seeing in the CSR spending now. And Mr. Cherian, let me come to you on this point. As I said, I was hearing one of your speech from 2015, and that was the year immediately after the corporate this CSR law kicked in. And I think that time we were quoting around 4,000 crore being spent on CSR, which is now hoping almost 22,000 crore, in the last financial year. And I think that was envisioned initially that at least 24,000 crore, and we have actually reached the figure of 24,000 crore as well in the year 1920. Seeing this, such a empowering environment which Mr. Bandyopadhyay tried to work for, and also, hearing what Ranjana ji said, that the women and their situation in our country is still need a lot of support which has to go in. You are primarily working in that space. How over the period you have seen that the companies which support your programs in the deep rural areas of Bihar and Jharkhand and Chhattisgarh are willing to do more on that area, and how much they are valuing the sustainability, or it still continues to be more of a charity giveaways rather than making some structural changes which are important to ensure that something which Ranjana ji described is not repeating if we come across any such eventuality like COVID-19 again. Those were the structural problems which kind of became more glaring at that time. The system problems, how much your partners now and your own work experience shows that we are now getting more aware and more conscious about making the systemic changes.
Thank you, Kamal, and thank you, India Health Council, for inviting me. I've been a traveler for the last 40 years with Ranjana in the social space, and was deeply involved with the CSR law and the guidelines which followed. So when we started doing the guidelines, we felt that the guidelines, just by doing certain activities, will not fulfill the sustainability goals or the sustainable thing. Essentially, whether it is 24,000 crores or 30,000 crores, I do not want to debate that. Actually, it is not the 2% CSR which is important. It is how the 98% of the profits are made. If the 98% of the profits are made by unsustainable methods, by unethical methods, and by destroying the planet and by destroying the people, then we can have no sustainability. I'm quite clear on that. So, of course, I influenced the Ministry of Corporate Affairs to move it into the guidelines should follow the SDG goals, which all of you are familiar with. And actually, being part of the jury, I've seen the very important work that all of you are doing in the health space, and very innovative. The second part of the CSR is, CSR has continued to be PR-driven exercise, and it is around the factories. It is around certain people whom the company thinks they should help, but it never reaches out to the poorest districts in this country. For example, we work in all the districts in Bihar on health strengthening work. Even today, there are 115 aspirational districts. Very few corporates are in those aspirational districts, which are the poorest districts. And of course, the public sector companies, because of an order from the secretary, has started doing work in the aspirational districts. So if you go to any public sector, they will work only in aspiration districts. And this change happened only in 2019. And then COVID came. And during COVID, what happened was a lot of the CSR went into COVID work, which is very, very good. But at the same time, what happened is it diverted money from other sectors into COVID work. So those who were doing education, Ranjana has talked about girls dropping out, people did not have digital devices, young kids in Jharkhand did not know how to study because it was all online. So I would say several million girl children have fallen off the grid. And we will not be able to know the figures even now. We only know about the deaths which happened. We know about the COVID cases which happened. And in care, what we did is we worked in all the districts of Bihar and Jharkhand. And we were providing not only oxygen kits, but we were also looking after the district hospitals where emergency wards were created. And I would say that we had a lot of help from doctors who came from all over the country and volunteered their time. People came even from CMC, Vellore, southern hospitals, etc., and they came and volunteered their time. And without this, we would not have been able to control the epidemic. And when it came to vaccination, again, we have been vaccinating people through mobile units. We have even started a vaccination train, which went through districts of Uttar Pradesh and Bihar, vaccinating people. So the figures are stupid. We have vaccinated several million people in this period. Now coming to this whole area of women and child development, I'll have to say that the first Asha worker was created by the non-profit sector by a Maharashtra NGO working in Pachod. And what they did was they took the traditional birth attendants who did the delivery, commonly called dais in Rajasthan and in North India, and converted them into, and they used the word Asha worker. And at that point of time, the Asha worker meant this lady will bring hope. This lady will be able to deliver a child without complications. This lady will be able to do other things which are required for a pregnant mother and also for the child, for the 6 immunization doses that you will take. And of course, because of their work, of course, they have received a lot of awards. They have received the International Children's Award. But today, Government of India has taken it and Asha workers have become a reality. So my last point is, if you want to do sustainable health, you got to look at the non-communicable diseases which are rising in the country. In every district, non-communicable diseases are rising. We had a brief spell of COVID, which is not in the non-communicable diseases, but all of you know those who had multiple morbidities suffered more. I would request or maybe appeal to these companies who are doing CSR to look at NCDs, to look at so that the districts which are unserved can be treated. Maybe the 115 aspirational districts, or maybe in your own area, there are areas which are poorer where you can do. Then you can have what we call as sustainable healthcare. Otherwise, sustainability will be only a dream.
Thank you so much, Mr. Cherian. A very important point, and I think that is where we all need to, and all our business houses need to, kind of ponder a bit more on it, because, as he mentioned that if your business practices are not, aligned to the welfare of the people, and, it is like if they are not doing enough good, they should not do any harm to the people around them. And that's why I think that's where responsible business practices play an important role. Keeping that in mind, let me go to Mr. Alok Ranjan. Mr. Ranjan.
Yes, please. Yes, Kamal.
Yeah.
Yeah, I'm here.
Alok ji, so, Mr. Cherian talked about aspirational districts, and you have been the Chief Secretary of Uttar Pradesh, which also has a lot of aspirational districts. The important aspect here is that how these the CSR funds which are coming from the companies is not getting equitably distributed to all those areas which have been underserved over the period. What from your perspective, and you have also been leading that UP's industrial body as well, and advising to many of them, where do you feel that how we can encourage and maybe incentivize them more to work in these aspirational districts and the areas which are more important and can have a sustainable outcome, rather than what happens normally is as Mr. Cherian said, a more PRable exercise?
Well, yes, thank you, Kamal. First of all, let me compliment the Council for Health and Wellbeing for focusing on this very, very important area of CSR with respect to the health sector. And we were part of the jury, and I do see that a lot of very valuable contributions have been done by the several industries in various areas of healthcare. So, and they'll be getting awards also today. You have asked me specifically about aspirational districts, and I've been hearing my predecessors also speak on these issues. Well, all said and done, I think, yes, you're right. UP has as many as 10 aspirational districts, and they are the poorest of the poor. And a lot of focus is on these 10 aspirational districts, on the Niti Aayog, from the government, on various departments in government. But whether CSR activities in these 10 aspirational districts are more than they are in other districts, there will be a question mark there. I'll also agree with this, whether evenly the CSR is being focused on these sector districts, or it is just on other areas. For instance, what I can see from my experience, that most of the industries, and I think this was pointed out by Mr. Cherian also, they focus on doing CSR around where their factory is. Normally, in UP I found that wherever their factory is located and wherever the workers are coming from the nearby villages or the nearby community, so most of the CSR activities are concentrated there. And so there is a regional imbalance as far as the industry is concerned also in UP. And most of the industry is focused in the western part of the state, particularly in Noida, Greater Noida, Meerut, Ghaziabad, and all these districts. And therefore, these industries will be doing more of their CSR activities, especially even with regards to healthcare or education or anything else in these villages. But when you come to the 10 aspirational districts, they are in the eastern part, right? Like district Shravasti, Balrampur, Gonda, Bahraich, these are some of the aspirational districts. And these areas have literally no industry worth the name. And so that is true. The CSR work that is being done by industry and the aspirational districts, what you're talking, I don't think there is a very close match between the two. Though I agree with you that there should be a match. Because when you are doing CSR and when you want to define CSR as collaborative sustainable responsibility, you would like to focus on what areas are really in need of funds, really in need of innovative schemes, innovative ideas, and where the private sector with its expertise and its funds, 2% as was pointed out in the beginning, from the profits are taken out for CSR, can really make a dent, they can make a contribution. So this kind of thing, something can be done in this area. It's an area which calls for some kind of thinking and kind of debate on how to make it possible. Then I think very nicely you have said that not only corporate social responsibility, I like this term collaborative sustainable responsibility. Sustainable is a very important word. And Mr. Cherian was right. He said, what do they do 98% of their profits? With what do they do with that? How do they make these profits? Well, if the entire manufacturing process and entire business practices are not of a sustainable nature, if they're polluting their environment around them, the air pollution, the water pollution, causing diseases, increasing diseases around them, then where is the need or the scope of CSR there, that comes in? That the whole thing becomes, empty, void, talking about it. So the whole question now comes is, if you want to have social responsibility or sustainable responsibility, this is what you must focus on. And I think what industry must realize is that profits are not the only goal. They have to be linked to the community in every possible way. And there are 3 P's actually. There's profits, there is people, and there's the planet. So they have to be concerned about people, first of all, about the health of the people, as we're talking about healthcare today, about the education of the people, and the planet, the environmental issues, which are so very vital. If you cause pollution, then you see what the result is going to happen because of pollution. So many, in my own experience as Chief Secretary, I found so many of the industries were polluting the rivers. They were polluting the air, and they were not using the devices which they're supposed to use to control this pollution. And there was some kind of a, with the pollution department also, some kind of an understanding whereby they would be allowed to go ahead with this kind of an activity. And only when somebody would go for an inspection would this start using their these devices, effluent control devices. So this, I think, in a matter of mindset and attitude, I think industry has to realize that just by, they think by through this they can make more profits. That's not the idea at all. Profits actually will come from the community. If the community is healthy, if the community is better educated, if the society is better educated, they will provide better people who can be employed by the industry, more productive people who will get better results for the industry. Therefore, there is a very close interrelationship between the community and the industry. And the industry must realize this, that the whole function is collaborative. It is corporate. Social responsibility should not be taken as something which has been forced upon them by the Ministry of Corporate Affairs. We said, no, 2% you have to give no matter what happens. And they somehow have to put into 2% out there. Many industries, you know what they're doing? They've created their own funds, foundations for this. And through those foundations, they're working largely in areas, as I said, where their workmen are coming from. But no, they must go beyond that. They must look at the entire society as such. Must look at the weak areas of society. Ranjana Kumari ji pointed out brilliantly about women education, about female literacy, about their lack of awareness, about anemia, about MMR, maternal mortality rates, about infant mortality rates. They're so high. In Uttar Pradesh, I've been Chief Secretary, I know. We have been trying a level best to reduce the MMRs and IMRs, but there is a huge problem. We are still far behind what the national average is, or at least where the southern states have reached. So maybe states like, when we talk about healthcare even, for instance, in states like Uttar Pradesh and Bihar need more as far as CSR is concerned from various industries to focus on, because the large number of youth is in these states now. Maximum number of youth in the working age population is in Uttar Pradesh and Bihar. And if these people are not healthy, if these people are not properly educated, then they are not the right kind of workforce which the industry would be needing. Where do they get the workforce from? These people will be huge army of unemployed people who will not be able to contribute in any way to the development of the society, of the country, or participate in the democratic process. Democratic dividend becoming a demographic disaster. That's what we were worried about. So therefore, I think at this time it's so very important that when you're talking of healthcare, there's so many issues of healthcare, very basic issues. Somebody talked about control of TB by 2025. Yes, that was there. Then of course, after COVID, everything has been exposed, that the basic health infrastructure in the country is not up to the level to handle the situation that is available today. And I, for one, would vouch for that nothing less than 2.5% of the gross domestic product must be spent on healthcare. So healthcare is such a vital sector. So whereas government should do that, government alone is not responsible. The society is responsible, and within society, industry, the corporate sector also must be very responsible, because they're employing people from the society, because the society people are their consumers of the product. And therefore, I think it's so very vital that they realize that the goal has to be collaborative and sustainable development of the society, and they must focus on genuinely coming up with CSR initiatives to the benefit of the people. ESG, many companies these days, in Western countries also, and this concept has come to India also. ESG meaning environment, social, and governance. So companies which are doing well in ESG are the companies in which people are investing now. It has become that kind of a profitable thing also, that investors want to invest only in those companies which are following ESG initiatives. So this kind of ESG indices are being built up of various companies to see what they're doing for the environment, for the society, and in corporate governance areas. So I think all these things are linked together: the society, the environment, corporate governance, all together when we talk about collaborative sustainable development. And yes, sustainable development goals 2030 are there, which have to be met by all of us together. And I'm sure if everybody gets down together, all stakeholders get down together and work in collaboration, we can make India a much better country. We can improve the health of India by leaps and bounds. We can improve the productivity of our people, our human capital, by several, a huge percentage.
Thank you so much, Mr. Ranjan. Thank you so much. And I think a very important thing which I, would like to reiterate from your, point is that the companies have to realize that they have to change their mindset and incorporate, not only profit, but people and planet all in that. And this mindset change, I just want a quick input from both of you, work in that receiving end of that CSR, as well. Is that change happening? Are you seeing that change? Because what the number shows is that, and that is, in comparison to other, years, it is almost same. But in the year 2020, which has been a pandemic year primarily, we have seen more companies spending more than mandatory 2%. That shows that there seems to be some, drive from them with some kind of mindset change, which is making them realize that they need to invest more in the society and the welfare of it. Is it just an outcome of the pandemic year, or you are really seeing some kind of mindset change as suggested by Mr. Ranjan?
So it's important to see collaboration, how it happens. The basic fundamentals of collaboration is mutual trust. You have to start trusting the people you're collaborating with. And also the other fundamental rule is that you must have empathy, sympathy, you must have commitment to change. If you don't have common understanding of what is the commitment to change, then that trust is missing. I think we need to still build that trust between the CSR money, which is available, whether it is forced by company law change and pushed onto the industry. So is there a way to really build that trust among them, that look, this collaboration between civil society organizations, NGOs, and also the policymakers and government as stakeholder, the whole investment will go a long way. Or alternatively, that if you don't trust, then what quite a few of them are doing, either giving it to the Prime Minister's fund, which of course will eventually get utilized for people, but also it's important that they themselves are channeling and routing the money from their own. And also, why should they make it a condition, as Mr. Pandey said, that to invest in an area where the industry is? I mean, Eastern UP needs it, Odisha needs it. I belong to Eastern UP, Odisha needs it. Bihar, many districts are totally zero industrial districts. UP has zero industrial districts. They need that investment. So how will they get that CSR money? Because, and also certain government rules needs to be looked at, like for example, for a lot of PSUs, now the rule is that you have to route these resources to a government agency. That means you have to identify some commissioner, some collector, someone through whom you should route this money, not directly accessing this money. We are partnering with a lot of corporates and they trust us and they're investing it. But at the same time, many are putting all these rules and regulations as barriers of identifying the areas that you must invest in. In health, I think we need, which are the areas? Nobody, it's open knowledge that we need to invest in women's health, we need to invest in children's health. But then how many have you really heard are really targeting those areas? So please, I would request all the CSR investment to be directed in a very, very organized manner to the areas which is needed. You may want your banner behind. A lot of them want, when you are doing any program, then they say, where is our banner? How much are we present in the social media? You people posted, but we are not there. Okay, we agree that you are, but this is not something for your propaganda. This is for people's benefit, for people's interests. It's for really making our country, it's a long-term goal. It's a vision that we should invest in. Not thinking about where am I in it? What is in it for me, or for my industry, for my company, or for my corporation? I think that approach has to change.
Thank you so much, Ranjana ji. And, I think the point which you have highlighted, that there are certain regulatory challenges also which need to be looked into. I think for the CSR to more freely and effectively flow to the people where it is needed. Mr. Cherian, your point on whether we are seeing a mindset change.
Yeah, over the years, I've seen a mindset change, especially after the CSR law is being discussed in the boardrooms. Because I sit on certain boards, and nowadays the CMDs are quite concerned about the CSR law. So whoever is managing the CSR is being asked, where are you working, how are you working, etc. So there is a change. it is not now relegated to the CSR manager or to the HR department as it was earlier. And so this is one thing I saw. During COVID, what has happened is all corporates came out to support, and in great measure, whether it is Bihar, whether it is UP, they did not mind where you worked. They would give you freely support for that. And plus, I've spoken to certain chambers of commerce, like the Indo-French, the Indo-US Chamber of Commerce, and all the companies then contributed towards COVID. And it was just a talk of 5 minutes for them to contribute. So, and it was also done on Zoom. It was not done on a physical forum like this. So there is a mindset change. And it is also an important thing that it happened. We have all realized how vulnerable we are. I always keep saying, you can be dead the next moment. And in COVID, that became true. I lost some friends, I lost some relatives, and we were not sure whether we would live for the next few months. So it hit back home. And then a lot of companies realized this, our own individual vulnerability, and they opened their purses during COVID.
Thank you so much. That's quite heartening. And I think that we are seeing in our, lot of those entries and the participation which we saw that corporates did, kind of loosen the strings of their purse. But
Kamal, I want to say, hello, I want to say one minute.
Mr. Bandyopadhyay.
No.
Yeah, just a second. I'm coming
Please.
to you only because there is something interesting I want to ask you, because
I want to say something very interesting.
Yes. So, sir, please.
No, you complete it.
Sure. So, but I hope this is not a temporary realization that you can kind of get a big support on a 5-minute Zoom call, which should continue. And I believe all our corporate friends who are here should continue this practice and should keep kind of contributing to the society without going with the preference of whether it is happening around your area, whether it is really going to carry your banner or not. As Ranjana ji said, I think a little bit of goodwill is important, but the CSR should not only be driven towards the goodwill alone, because what you are trying to do is to make a more sustainable environment around you so that your business can sustain in that. Mr. Bandyopadhyay, I wanted to ask, because Ranjana ji also flagged one of the major issue, I think, which is regulatory related, in terms of implementation. But I think there is one other major issue which I think, becoming a quite a hindrance, and also in a way is an inherent, contradiction. You have been propagating and promoting the cause of not considering CSR as charity, while if we see the taxation system of on CSR is still it is considered to be more of a charity or a donation, not as an investment or a business expenditure. I think why not make CSR a business expenditure, because this is where you are trying to sustain the societies, the communities around you, and you are kind of investing into that. So shouldn't it be considered as a business expenditure rather than is still giving it a tag of a donation or something like this, which make people take multiple sideways of ATG or something of sort to kind of get the tax benefits? Okay,
thank you. Let us try to put some clarity in the whole discussions. I'm very, very happy to listen to all these participants here and also listen to you. I just recall that when we started the CSR thing in 2009, we had traveled the whole of the country in the different capital cities, state capital cities. We held a meeting with the corporate world. And there they told us, that was the objection, that we are giving 30% corporate tax to the government. Why should we should pay CSR? This is not our duty to help the villagers, to help this thing, to do that thing. Mr. Ranjan must have also heard this thing. This is the government's responsibility. So that was it. That was those days. And from those days to now 2022, whatever we are hearing, that a lot of changes has taken place because of that policy decision that it has to be a boardroom policy. You know, our answer to those questions were at that point of time in the two of my joint secretaries are now secretaries in Government of India. They also were very much involved. So, you know, our answer to this thing, if the poverty remains, if the increase of the poor people, and there will be a lot of uncertainty, there will be a lot of terrorism involved, then where will your industries go? Suppose you are a mining industry. You want to mine something, and in that area, I don't want to name the area, you all understand which industries I'm focusing at. So how will you mine anything to run your industries? You have to do something for this field. And that can be done in this way. And throughout the country, we have told this thing. Fortunately, most of the people have supported us. And later on, of course, it was made into law. But again, as I said, we used to make law only after discussing with all the stakeholders. So they all agreed. Majority of them had agreed, yes, there is a need for this thing, and that should come. You see, the point is, let us not see the CSR as a panacea for all our problems. There are other agencies, there are other funds, there are other types of systems, all should be put together. CSR cannot change. I was also district magistrate and divisional commissioners in different places. CSR cannot improve our own systems. If our systems collapse, if our education system collapse, if all other things collapse, just few companies, CSR cannot help us. So it is an all-around approach. Now, coming back to the present thing that I have been dealing with, I was actually one of the advisors in the Southeastern region for the SDG. You know, the SDG goes that the whole world is championing this thing. Unfortunately, because of the COVID problem last 2.5 years, not much things have been being done. The ethics and everything is involved. There, the companies, corporate world has been given special responsibility on different goals of the SDG separately about this. And they are championing. Many of them are coming up. Many of them are championing because from India also, number of good companies are doing that type of thing, which many of you have said that, you know, the sustainable development. So they are also getting involved in sustainability. Now, we all know the profit, planet, and people. These are the three things that had to be looked into, that had to be given a lot of importance. But mind it, if there is no profit, there is no company. So one should not go beyond a point that, as I said, that cannot be a panacea of this thing. They have to earn profit. Of course, they have to do it in an ethical process. Of course, they have to see the environment is not damaged beyond repair. Of course, they have to see that the people, against people, something cannot be done. So these are the rules of the these are the rules and regulations of the government, of the various departments, various functionaries of the government. They have to see the proper rules and regulations should be in place, which should not stop the corporate growth, but we should guide, help the corporate growth in the proper desired way and desired level. That is the purpose. And for that, the education should be at different level. The persons who are guiding, the persons who are doing, persons who are heading even the NGOs and persons who are heading the government institutions, different organizations, they have to be educated in this. That is also very important. Organization like yours.
Thank you so much.
Just one minute.
Because I'm anyways running out of time, sir.
That's right. But these are very important issues. You can hold some seminars, we can talk about that. But this is very important that overall thing will be taken. As I said, I mean, health is very important now. But education may be important, if you look from the other points of view. There may be lots of other things. Look, let me stop here because I see you are running time.
Thank
and
you,
these
sir.
are some subjects one can speak for hours.
Yeah, I can understand, Mr. Bandyopadhyay. You are very passionate on this area, and I think can share a lot of thought on it. But since I'm already running out of time, and our other speakers are already waiting, so quick remark, the closing remark from all of you. But let me start with the Ranjana ji. Ranjana ji, health is important. It is all of us know now and realize. That's what Mr. Bandyopadhyay also just mentioned. How we can collaboratively do more in this post-pandemic world. A quick remark from you, which can be a takeaway for our the community of CSR spenders as well as executioners here today.
Well, as Mr. Bandyopadhyay said that your money 2% coming from various corporates, it's important to identify the sectors and have some concentrated investments, not charity, but have investments to get proper results in terms of health, instead of sprinkling it all over the country. That's another ambition that we need to control, and we cannot be, in south of India, and all the problems cannot be addressed by sprinkling small resources everywhere. Go for a well-planned initiative, put the money together, maybe all the health sector corporates can come together and address the issues collectively. I think that strategy will work.
Thank you so much, Mr. Cherian.
I would advise you to look at two indicators. One is infant mortality and one is maternal mortality rate. If you can reduce these two by 2030, if you can bring it down to under 20, and of course, I'm not asking you to bring it to the Kerala standards, but try to bring it under 20. So if you can do that, then lots can be done, because many children die at childbirth, the mothers also die at childbirth. This is one thing you people can do by 2030.
And do it, across the country, not in certain pockets.
Across the country, wherever you can.
Problems are also concentrated.
Yeah.
Kerala doesn't have much of
Yes. So, Mr. Alok Ranjan, a quick remark from you, sir.
Oh, well,
How we can, kind of make these CSR spenders more collaborative work on these areas. A quick one, sir.
And the good thing is that the whole mindset about CSR is changing from something being imposed upon them by law as something which the industry people are now realizing that it will help them to get closer to the community. And if they get closer to the community, it ultimately helps them also. The whole thing is about giving back to society or giving back to the community, which is giving you so much. I think that kind of realization when it comes to the industry, they will be able to do valuable CSR. They should not see as a burden or something like charity, but something which is essential for them to invest in the human capital. I simply want to say is that we have discussed all the issues out here. Healthcare is very vital, but healthcare we can take as a holistic approach. When you talk of healthcare, healthcare is linked with drinking water, it is linked with sanitation, it is linked with hygiene, and it is also linked with education, particularly education of the girl child. So if you take it as a composite whole, then you focus on this area, I think certainly it will lead to your development of the human resources and a holistic approach to development. Thank you.
Thank you so much for your remark. And I think now we should take this to the conclusion. And I really wanted to take some questions from the audience also, but maybe my bad time management has made me run out of the time. I believe my next panelists and the moderators will be able to take some more questions from the public also. But what I think has been very clearly amplified here is that if we really want to kind of ensure the health of the nation, which is very, very important, not only for the progress growth of individuals, but also our business houses, our corporates, and our industry. And for that, what is more important, if we can take something more concentrated, and channelize our resources, energy, Mr. Cherian also said, and I think Ranjana ji also aligned to the same thought, and as other panelists also, if we are able to just, at least address the problem of women and child health in our country, this is going to have a lot of benefit in terms of overall improvisation of health outcomes of the nation, the health standard of the nation, and also in terms of reducing the intergenerational health burden which we are seeing. So with this, thank you so much, sir, and ma'am, for being with us today. And I hand it over to Anisha again, and for the next panelist to be invited. Thank you so much.
So it is off for us.
For that discussion. Really a collaborative way going ahead is going to be the one which we will see companies adopt, because companies themselves have realized post-COVID that the good work that they do adds to the brand value, adds to consumers wanting their products. So I'm sure this will be the logical end where this will go to. We want to thank all our speakers for taking the time and coming here and sharing with us their thoughts and their strategies. In an era of intense competition and unprecedented changes due to both environmental and human factors, the very concept of CSR has witnessed unprecedented interest and, most importantly, investments for many renowned companies and agencies. Interestingly, what was once viewed as forced spending, the modern CSR has prompted a change in mindset of companies, making them consider how to make a world a better place to live by including CSR in their core values and agenda. Therefore, the new age companies are transforming CSR from a one-off event to a kind of a culture so that it can develop into a grassroots agenda. In our next session, our speakers will shed light on how there is a paradigm shift from the traditional CSR to collaborative sustainable responsibility, and how it is becoming an important culture adopted by companies. So please join me in welcoming on stage our esteemed dignitaries who will be talking about this important issue of trends of collaborative sustainable responsibility. Please welcome on stage Mr. Vijay Sethi, former CIO, CHRO, and CSR head of Hero MotoCorp. He is going to be moderating this discussion. Please put your hands together and welcome on stage Mr. Sethi. He's a technology and sustainability evangelist with more than 30 years of experience. He has previously been with Hero MotoCorp, where he was the Chief Information Officer, Chief Human Resources Officer, and Head Corporate Social Responsibility at Hero MotoCorp. Before this, he was with Brand Baxi. Please also welcome on stage our other speakers in this session. Please welcome Dr. Farhat Mantu, General Director, MSF South Asia. Please put your hands together and welcome Dr. Mantu on stage. With almost 2 decades of experience of working in Asia, in Europe and East Africa with MSF and other organizations in management and leadership roles, Dr. Mantu has a specialization in medical entrepreneurology, communication, hospital management, and human resources, apart from being trained in humanitarian assistance. Please also welcome on stage Ms. Meenakshi Batra, Chairperson of Idea to Impact Resource Alliance India. A round of applause to welcome her on stage, please. She's a seasoned and widely recognized international development professional with more than 3 decades of multifarious experience globally. She has served in various leadership roles with international development and humanitarian agencies in South and Southeast Asia. Please also welcome on stage Ms. Sooja Warrior, Head of Sustainability Project, Emphasis. I think Ms. Warrior will be joining us virtually. She is with Emphasis as a senior leader in diversity and inclusion, HRD, along with a contribution to CSR and employee volunteering with corporate sustainability reporting and governance. And she has 25 years of experience in corporate functions. So a round of applause for all our speakers on stage. Mrs. Sethi, I'll hand it over to you to take this discussion forward.
Thank you very much. Thank you, Nisha. Thank you. Thank you, Kamal. And thank you to the speakers who were there in the last session, interesting session. Good afternoon, everyone. And also Warm welcome to my fellow panelists. I can also see Sooja out there. She said she's in Kerala today. So I hope the connectivity continues. There's some issues over there in terms of rain and all, but I just hope for next 45 minutes or so it continues. So I think what we want to discuss over next 45 minutes is how CSR has really changed over years. All of us know that CSR law came in 2014. Initially, companies were trying to find their feet into as to what they should be doing. They did some bit of work. Prior to that, companies were more into charity. First 1, 2, 3 years, maybe till 16, 17, it went into planning. And then companies really put up projects and started working. But then came COVID. And suddenly the entire thing really changed. What I've seen based on my own experience over the last 7, 8 years that I've been part of CSR and various other activities, related activities, especially maybe around 2019 or so, companies started to getting into a way that CSR was becoming part of the culture, the point that was made in the last panel discussion. And companies were working on that. And then when COVID came, most of the projects kind of got derailed. People from the normal projects got into food. So you have to ensure that food is there. You have to ensure masks are there, sanitizers are there, go into hospitals, put in oxygen plants or concentrators and things like that. But one good thing for all this was that the employee involvement in this entire thing, in the CSR phase, really went up. So that, to my mind, will be the first part of the discussion that we will have with our panelists and get their perspective on how they have really seen as to how CSR has changed over the last few years. From the initial, if I can kind of use the word that 2013-14, it was more of a photo op that you need to really go over there, plant a tree, you have to do this thing, take a small kid on the street, pick up a photograph, and then publish it somewhere and be happy about it. And from that, it moved into that you are really doing a lot of stuff on ground and making an impact. So I'd like to maybe start, if it's okay with you, Ma'am Meenakshi, as to how have you really seen things changing up over the last 4, 5 years, 7 years? All yours.
Thank you so much, Vijay. My journey with CSR started in 2013-14 when the rules, were being rolled out. And I was very much part of the consultation processes that the IICA was undertaking. And very, very interesting debates, very, very interesting discussions, lots of goodwill, lots of resistance also to the whole idea of CSR. Some were very much welcoming the whole CSR provision, and there were others who actually were resisting it. And from that, I've seen a sea change happen over the nearly a decade. I mean, next year we will complete a decade of CSR. And I remember, meeting some corporate colleagues who were new to CSR, who were in mainstream corporate jobs. And there was a lot of distrust of not-for-profit organizations. And they were worried, there is a lot of hard-earned money, and how will this money be spent? Would the organizations utilize it properly? So those were very real concerns. And therefore, I used to get requests that find us a project, within an hour of Delhi NCR or Mumbai, so that, people could easily visit and see. And also from a learning perspective, employee engagement perspective. So in some ways, their request was quite correct, but also I felt that this was really creating a lot of inequity in the not-for-profit sector, where the NGOs doing really great work in remote areas would not have access. So therefore, the journey was about, a joint process of learning along with them, because NGOs were also new to the CSR sector. So it was a joint learning, and taking a step at a time. And we have come a long way, since then. A lot of learning has happened. Corporates who started, I'm also saying at this same time that there were corporate organizations who were doing CSR for decades prior to this, these rules came. So there was a lot of experience, but in this new framework, and where everybody, with a certain profit had to do it, this was new to many organizations. And now I see that, since then, where it was like find us a project where our employees can volunteer and we can see the projects. I have been able to, I have worked with about 300 corporates over these 10 years and about, 700-800 not-for-profit organizations. And I have been able to move about 60% of work that we were doing, essentially urban, to the rural areas. We still have to go far. I mean, we haven't really gone to Northeast and we haven't really gone to the deep pockets, but I think good progress has been made, and 10 years is a short time in a long journey that we have jointly undertaken with
Sure.
between the not-for-profit organizations and the corporate world.
Wonderful. I think you're right. 10 years or 7-8 years prior to that, also companies were doing a lot of stuff. But to my mind, how I see is that the law really brought a system to the entire thing, a process to the entire thing, and a focus that was given by the corporates. Companies did set up the teams, and now with the amendments in the law, making even the impact assessment and things like that really mandatory, that really helps, and the entire thing is going into beneficiaries. So Farhat, you have been working globally in various locations, and your organization also is working. How do you see really in India this entire thing shaping up, and how the changes have happened in last 7-8 years? What's your own impression now?
Thanks, Vijay. I'm going to put forth some wider perspectives. The first one I'm going to talk about is corporate governance, how that is evolving and what is the impact of that on CSR. So when I talk about corporate governance, gone is the time when as a board, you would only be accountable to your shareholders. Now how we have evolved as companies, not only in India, but globally equally, is that they are looking for what is beyond the balance sheet. What is that companies contribute when it comes to environment, when it comes to social responsibility, when it comes to governance practices. So what we see is like with evolution of governance practices where ESG parameters are more important, we are also looking at such laws of CSR. They are actually accelerating to bring more structure and accountability and more visibility in what needs to be done. So it is not that charity is a new concept. It is not that there was not social mobilization in the past. What with CSR has changed is that there is more systematic looking into it. However, what I want to say is that as much as Vijay, you made a reference to COVID, in many ways did divert a lot of attention to just one problem, that is COVID, because it impacted each one of us. But then it also created a massive gap on non-COVID things, as if overnight nothing else was there other than COVID. So that's one perspective. So as much as COVID has helped us, it also has slowed us down in many ways. The other aspect is that more and more youngsters, and that's where I have a lot of pride in the generations that I'm experiencing when I talk to my colleagues around, when I talk to people that are part of different companies. They want to know what is the purpose of the company, what is the employee value proposition. So now if we look at CSR, we are moving from CSR to CSV. And when I say CSV is creating shared value, which means that people want a meaningful engagement. And all these elements of governance, how individuals want to be part of the bigger change, and how they want to take care of not only their problems in the home, problems in the backyard, but beyond their borders. That is what is kind of a change that we see. And for me, CSR is one of those means to achieve it, and it is not an end in itself.
I tend to fully agree with you. COVID did really kind of negative thing was that a lot of projects which were happening earlier, a lot of schools which were being kind of supported by various organizations, a lot of villages, SHGs, the focus changed from that into something which was to be done at that time, but perhaps rightly so, because there's no other option. Otherwise, there could have been major issues. So coming to you, Sooja, I know you're in Kerala, but from Infosys perspective, so you have a very different thing. You work in a corporate. How do you see that? How kind of CSR has changed over the last few years? What's your own perspective? What do you see in that part of the country and from Infosys perspective? Can't hear you. Are you on mute?
Namaste. I'm so happy to see all our co-panelists. I mean, actually, I'm very happy to see you here after a long time. Of course, to be very frank, when you look at me as an individual, when at a point of time there was nobody even heard about even the CSR, I used to work with the schools and projects on a personal basis. I used to have a lot of volunteers working with me to help the children in the school, and we have started some projects which has only collection of money in the campuses. And you don't believe we have collected lakhs of rupees from individuals, and then we started donating the books and all that. With actually, if you look at it, that was a spark for many of the employees to contribute to the society. And at later points, like when the law has come, we were very happy that we can expand our reach and expand our work. And Infosys Foundation was formed maybe 26 years back. We were contributing to the society when nobody even heard about CSR. But employee volunteering became very big from the year 2007, which I was a part of the thing. And I can say that I was leading that project at that point of time. And thousands of volunteers contributed to the society in different ways. And all of them, some or other, moved to different locations, different companies, and they were all leaders in that space at some point of time. Some of them moved to even the social sector permanently and working with the schools and colleges. And that is something maybe at that point of time, but if you look back, things have changed. And I can say that the bigger organizations have bigger impact to the society, maybe small negative as well as positive. Positive, I can say that they are the job creators, they are creating innovation, and they are also helping the infrastructure development on overall development of the community. But when it comes to negative impact, I can say that they may be the player, the smaller player may move out of the society or the community or from the market itself, and a monopoly will come to the economics. But at the end, like what I am feeling that maybe from that past, the employee volunteering, collection of money, contributing to the society, we move to a systematic position where we can contribute to the project which are related to SDG goals. If you look at our report, Infosys reports, you can see that all our projects are aligned to SDG goals. And every report, at the end of March, we release our report. And the report has all the alignment in place. And we are also moved from the sustainability report to ESG report. And the governance part, our colleague has mentioned, which is very, very important now. And environment is one of the areas which we are very, very careful about it. Because I can say that a single individual can even stop the organization's business. I can take an example of Mailamma, who is from the Pachimada village of Kerala, Palakkad district. She stood up and said that I don't want a Coca-Cola plant in my place because it is affecting my water. Water bodies are getting affected. You don't believe within a year of operations, the Coca-Cola plant shut down forever. It's not happened anymore. And she must be a tribal Adivasi single woman, but that sole voice was heard by the community, and sole voice has to be heard. So that is the impact of an organization. When you are doing things which is wrong for the community, it may even stop. But fortunately, when we have this system in place, now all the CSR projects are happening in a very, very systematic way, because it is no more a charity or a checkbook donation. It is actually a business imperative. To be very frank, we are very, very clear about our projects, and we are also, diversity is also becoming very, very important now. We are also focusing on women education, girl children education, and also the PWD part. I am with the diversity and inclusion now, and I am focusing on the PWD part of the organization. We want to make our organization inclusive, getting maximum employment. And all these things, skill development is another area where we are working with NASCO. And I think I'm very proud that this law has put things in place for the way, that is a way forward. because as a person, I lived in Golpara, which is one of the first aspirational districts of Assam, where I lived for community project. 2 years I was out of Infosys and working for a community in Assam. I was staying there and I realized that nobody is there to help them for anything because no industry nearby. And that perspective is also gone by having this aspirational districts philosophy in our CSR policy. And I'm very grateful for that. I think this is what I wanted to say now.
Thank you. I think your Assam example is really inspirational. Thank you very much. And all the inputs you gave were really brilliant. Now, I remember over the last 7-8 years as we got into CSR, and one of the key things was how does one really grow CSR? How does one make CSR as part of DNA, culture of the organization, one of the points which was said. And I personally had a kind of thought which I used to propagate a lot. So the two things which I used to do, one was a term called ISR, beyond CSR, which is the individual social responsibility. That at the end of the day, all of us are part of this society. So it's not just the corporates or the government, which is really has to do a lot of stuff, but as individuals also. And that's where volunteering within the organizations or at personal levels, so that came. Another thought I always had, and I was really happy when yesterday or day before yesterday, when Kamal and his team got back and said that we have this session, which was on the collaboration. As to if I'm going to a particular village, if I'm going to a particular community and trying to help, the beneficiaries are there. Why should few companies over there or others come over there and compete? Can we do something collaboratively to ensure that the development of that area is taken? So if one is taking a part of part A, can someone add to that? So 1 + 1 will always be more than 2, and it will never be less than 2. So rather than be working in silos and trying to do things our way and trying to show it in our own reports that we have done a wonderful, but we change the entire paradigm and bring the beneficiary at the middle of this and say that for this beneficiary, if 3 of us or 3 of the organizations can have to work collaboratively, can we really ensure? That was one from a social responsibility. And then of course, with all the changes that have happened, and we also heard the word SDG a couple of minutes back, sustainability in itself came into play, and that's where perhaps the term that Kamal, you and your team have used for this thing, which is collaborative sustainable responsibility. I think that really changes and takes CSR to the next level, and that brings me to the second part of our question on the sustainability and the collaborative. And before I really come to a question, I just have 2 thoughts, which 2 of the quotes which I really like. One is by Charles Darwin, and all of us know so many quotes from Charles Darwin, but this is slightly different. So it says that it's a long history of humankind that those who have learned to collaborate, most effectively are the ones who have really progressed the most. So which basically means that, coming back to the corporates and even to the beneficiaries, those areas where there's huge collaboration among the donors or corporations, or those corporations who really collaborate from beneficiaries. So these two, when they happen, the impact on the beneficiaries would be the highest, and that's where collaboration really comes. And the second quote, again, which I really like a lot, is that many ideas, and I quote over here, many ideas really grow better when they are transplanted from your mind to someone else's mind, and in that mind which can nurture it more. So when I go to a community where I have to really do something, but while I have certain thoughts, but I may not have the best expertise to do those things, can I really collaborate and share with some other organizations that I am working with this community, I am working with this potential set of beneficiaries? Can I really give my thoughts to them, those companies, rather than thinking that, no, it's my idea and why should I really share it with someone? Can I really get into that collaboration? And that will really, number one, give me personal satisfaction that, yes, this is what I had thought for this particular community. I couldn't do it. I can't do it. I don't have that either the competence or any other thing that I may lack. But I know there's somebody else who can really take this idea forward, and that beneficiary will get really benefited from that. And that's where collaborative thing really comes up in a big way. So those are some of the thoughts. When I heard about collaboration, I was really happy. And so let me just come back to you first. Sooja, let me first come back to you. I don't know whether you're there. Yeah. So what is your own thought about the entire collaboration? Should companies be collaborating? Should the various other organizations which are there to help beneficiaries, should they be collaborating? Or is it that let all of us work in silos and just give our own competence and don't care about collaboration? I know you are shaking your head, so I know the answer, but I'll hear it from you.
I think I am so happy that that question came to me first, because right now what I am doing is I am working with a project called the Brindavan Widows. And the 15,000 widows are in Brindavan, Mathura and Varanasi. And all of them are stranded there, maybe for their own reasons or maybe dumped by children. But what I'm seeing is everybody is working in silos and they need all kinds of support. If you look at healthcare, if you look at technology and also the infrastructure or maybe the rations, all these things they need. And for me, I was trying to reach out to every organization who are working in different spaces, maybe a technology company, a TV manufacturer, a big basket kind of people, or maybe infrastructure. All those people can come together and help in that project. Almost 15,000 mothers will be helped. And I was actually reaching out to multiple people because it is an ideal project for healthcare also, because all of them, when I started working with them, I realized that every aspect of things can put in place there. Healthcare, they are all mothers who has health issues, even the dental checkup or the bone issues, or maybe the, what is called every other health issues they are facing. And also they are all asking for a TV in their room. In the government, it's ashram is run by government, the infrastructure is by government, and you can actually invest money to get that infrastructure developed. And also some of those things which you can help them with a Sulabh. I am working with a Sulabh actually. Sulabh, what they are doing is they are giving ration to them and also a pension to make them live with respect. What we are actually doing is what we are doing and giving it to them is what we wanted. No. We have to check what they wanted. Every mother wanted some money in their hand because they feel that their children will come someday. And when I visited them, they feel that I am their child. They wanted to make a cup of coffee and give it to me. So these are all openings or all stories, which hundreds of stories like that coming into my mind when you ask me that question. This is the right, these kind of projects are the right collaborative effort where the technology company or maybe a government as well as the community around can work together and make it possible for the betterment of their life. And I'm really happy that the public-private partnership is the only way forward. We cannot work anymore in silos because I may be good in technology, the other person may not be good in, and we have to work with the society or the community because they know the grassroots level issues. And the government has the best system in place. If you look at Akshay Patra, you can see the student details are all from the government system.
Thank you very much. Thank you very much. On a lighter note, why I went you to first was I was also reading mind over here. I could see that maybe I was collaborating with your mind and said that okay, Sooja is there to answer this question first. Thank you very much. Let me move to
There are so many projects I am passionately chasing. I want this collaboration to has to happen.
Great, fantastic. So Meenakshi, over to you.
So, I was, when the whole CSR thing started about a decade ago, in the early stages, I was very lucky to experience a very fine collaborative project. So I'll just explain a little bit. It was a project where we were supporting sanitation infrastructure in about 1,000 government schools. And we had on this particular platform about approximately 19 corporates come together with their funding and with their other kind of infrastructure support. We had a media partner, NDTV, at that point of time, and then of course we were working with government schools, so there was this whole engagement with the government, with the education department, with the teachers, with the students, and also the communities, because we had an element of community participation or through the parents-teacher platforms which exist, and the children. So lots of children were engaged because it directly impacted, particularly the girls who faced a massive number of problems during their menstrual period. So they were very much at the center of this whole program, making it a success. In turn, because it was a media campaign, we were reaching out to general public through the media. And we brought, and the general public, of course, was, we were looking at awareness raising, but also fundraising. So we received a lot of funding support. In addition to the corporates, these general public also provided a huge amount of support to this whole program. And over 5 years, we were able to reach out to about 1,000 government schools where we built toilet infrastructure for girls and boys, a hand washing facility, computer labs in the school, libraries in the school, general upkeep of the school premises and playground, etc. Quite a few of those additional elements where additional funding was available for specific things. And this was a very fine example of multiple partners coming together and making a reality. If it was one corporate, they wouldn't have had the bandwidth and the money also. Even if they had the money, they wouldn't have had the bandwidth. And of course, I must not forget, we had about 25 NGO partners across the country who were our partners in actually delivering the programs on the ground. So with this collaboration, I will also go back to your point about employee engagement. That to me, I think is a very significant part of this whole engagement of corporates in the social sector. Because, and particularly from NGO perspective, because, NGOs communication in the past, generally speaking, has been largely with the communities to whom they are serving. And there has been, because there was, some funding which came from some philanthropists or from overseas, etc. There was very limited amount of, generally speaking, very limited amount of engagement that not-for-profit sector did with general public. And here, through employee engagement, who are volunteering their time with the NGOs, sometimes very superficially, but also a lot of times with a lot of depth, with quality, on need basis, on what a particular community or a not-for-profit organization requires. So that brings additional skills to the sector. At the same time, it raises awareness amongst the employees who are part of general public beyond the social sector, so-called social sector people, raising awareness about core issues, which I think is laying a strong foundation for the changes that we want to bring into our, our country, social development changes that we want to bring. This, I think, awareness beyond the direct actors like government or NGOs or CSR teams, this awareness beyond that is very, very critical if we want to really bring any meaningful and long-lasting change to our world.
Thank you very much. To my mind, yes, collaboration has to be there, and it's always good. An example that you give, 25 NGOs really collaborated well. That's fantastic. So I'm reminded of what Helen Keller once said, that alone we can do only little, but together we can do so much. And that's where all these enterprises can really work and put in their best efforts to ensure that the beneficiaries are there. So let me move on to Farhat. Farhat, from your perspective, how do you see collaboration really going up, and what's your own perspective? Going up, going down, either way?
Okay, I'm going to use a different term. So I'm going to widen the whole concept of collaboration and move on to power of the collective. If we just look at this room and all the heads put together, all the ages together, number of years of experience, I can very safely say we have 500 years of experience in this room. So what I want to illustrate through this example is that the power of collective, be it collective working in an ecosystem, because what do we want to do? We don't want to duplicate, we want to build a meaning. So when we look at collaboration, I think of late, one of the things that our organization has been focusing a lot is on person-centered approach. that the individual is at the center of anything we do. Any design we make around any project intervention, your individual or your community is at the center of it. And I'm not going to go far for some examples. I had the privilege to look at the entries that came for the Health Impact Awards. And I must say that I'm really humbled and privileged to get a chance to look at all of them. And some of the examples I'm going to quote out of that. Give India, a wonderful platform, 102 NGOs working together, brilliant. Talk about Cape Gemini. Look at what they have been doing. Individually, they could have done one thing, their collaboration with IIT to look at developing antigen. Then they looked at how to address the problem of seeds and fertilizer shortage. Then they created a Kisan Mart. Then we talk about they wanted to look at how people who are in quarantine, how are they taken care of? They created a tool, Code Track. Then they looked at the mental health. They created toll-free mental health helplines. Then they looked at misinformation that was spread around because COVID was a novel virus. So there was a lot of information that was not based on pure science. So they joined hands with UN initiative on misinformation. And Cape Gemini was coordinating, collaborating, harnessing on the power of the collective. So these are very few examples. And I just want to say all the 80 entries, they were brilliant. And each one of them illustrated. And if we just look at them, there is so much to learn out there. And I just want to take 1 minute because I know that there is something. We do have a drug-resistant tuberculosis program in Maharashtra, Mumbai. And there's a choice. Yeah, we know that India has a massive burden of TB. And there are lots of policies put in place. As an organization, what did we choose? We chose to look at that niche nobody else is focusing on. And the intent is that we create models that can be replicated and scaled up. So I think it is very important to, when you look at collaboration, is that what is the end goal you're contributing to? Because many a times we just want to spend the money. We just want to spend the money because this is to be spent in the financial year. And trust me, there are lots of people out there that would really benefit because COVID taught us one thing. It taught us that it is no more a matter of excess. It got all of us equal. So we have something coming ahead of us. That is the climate change. There is a very clear link between climate change and health. So in 5 years' time, I'm sure on the stage, and I'm looking at you, Kamal, you would be talking about planetary health and how companies, CSRs, would have to really look at things like carbon offsetting. And your CSR would be connected to that. And not just parameters of what is the impact. Are we monitoring it sufficiently? Are we making the change? So the change would be more holistic in nature. Over to you.
Thank you, Farhat. And
add a very quick point. I feel that at this stage, 10 years into the journey, there are really great examples for us to learn from. But this shouldn't make us feel that we are really doing great. I mean, I think there is a long way to for us to go. And if we really want to achieve the scale, the comprehensiveness, the integration at the community level, and the long-lasting sustainable impact, then it's very, very important that we keep doing more experimentation and replicating those examples across. And every day, when we design our projects, NGOs and the corporate world, they should think how can they collaborate, partner with others for achieving the scale, the comprehensiveness, and the long-lasting impact.
And thank you. And you're right. CSR is a journey. It's not a milestone that we can. So maybe 30 seconds each. I know we are running out of time. So we'll start with you, Farhat. So if collaboration has to be there, if you can just share with our audience as to what could be a potential do or don't, just max 30 seconds, preferably less than that.
Just make sure that the purpose is very clear. What is the end of collaboration? So what are you collaborating for? Who are you collaborating for? I think that is quite crucial. And make sure that there's due diligence. There is accountability and transparency. Whatever we are doing, we are accountable not only to the people who give us money, but the people who we are supporting and helping. And that is very important. Do not forget the last one in the value chain is the most important one.
Absolutely. Sooja, your point? Quick one, Sooja. Maybe
All the
yeah,
stakeholders,
Sooja is there. Yeah, go ahead.
yeah, all the stakeholders are looking at an organization who has a purpose. No more the profit is the only purpose. And I'm sure that that is the way forward. And all of us, like the collective, what she mentioned, we have to work together and make it happen. And that's my message.
Thank you. Meenakshi, last word.
So, I mean, I will repeat, my last point about if you want to really scale up, have deep impact and sustainability, it's very, very critical that we make efforts in this direction.
Thank you very much. So collaboration is the name of the game, and if we really have to scale up, we have to collaborate, and that's where I'll leave it. And also, as Farhad said, the entries were fantastic. So I must compliment all the 80 entries and all the winners who would come in. Thank you very much, and back to you, Nisha. Thank you.
Thank you, Mr. Sethi, for conducting this discussion. Big thank you to Meenakshi ma'am, to Dr. Mantu, to Sooja ma'am. Thank you all for joining us and sharing with us your thoughts, your beliefs on the importance of collaboration in CSR going ahead. Now, in our last discussion of this evening, we're going to talk about CSR for public health awareness and diseases. Now, ever since the COVID-19 pandemic broke out in 2020, it has never been more urgent than now for corporate entities to recognize that they need to do more for public health awareness on women's health, infant and child health, and do more focus on diseases such as cancer, stroke, and heart rehabilitation infrastructure, because these are becoming very, very common and need immediate intervention. CSR is constantly being redefined from what it was in terms of traditional corporate spending, and this rapid change needs to bring CSR attention to public health awareness and many emerging diseases impacting the underprivileged. The following session aims to throw light on the growing need for CSR into public health awareness for women's pregnancy and overall health and other diseases that in the long run will shape the health of our societies for good. So please welcome on stage our esteemed speakers in this discussion. Please welcome on stage Dr. Hema Divakar, Consultant of Gynae and Medical Director at Divakar Specialty Hospital, Bengaluru. Please welcome her with a round of applause on stage. She will be moderating this discussion. Please also welcome on stage Dr. Brigadier Rakesh Gupta, Director, Government Institute of Medical Sciences, Uttar Pradesh. Please also welcome Dr. Basav Mukherjee, gynecologist, obstetrician, and reproductive endocrinologist. Please welcome on stage Dr. Deepak Chopra, Business Unit Head, Buyer. Ms. Sumana Bhasin, Senior Director, CSR Fundraising, Impact Guru Foundation. Please put your hands together to welcome our esteemed dignitaries on stage. Please welcome Dr. K. Madan Gopal, Senior Consultant, Health, Niti Ayog. Please also welcome on stage Dr. Rishikesh Pai, Medical Director, Bloom IVF, and President-elect, Foxy. Round of applause for all our speakers on stage. I would now like to hand it over to Hema ma'am to please take the discussion forward.
Namaskar. Good evening to each one of you, and a hearty welcome to my very distinguished panel members here. And on behalf of all of us, hearty congratulations to all the winners of the CSR Health Impact Awards. Thank you, Kamalji and team, for their kind invitation. Always the think tank of IHW Council churns out an idea a minute, a program every day. In keeping with that, the last of the panel discussions for this evening, before we move on to the award ceremony, is about, on one hand, when we say ignorance is bliss, the other hand, we say knowledge is power, and we need the public to be aware of the various preventive healthcare methodologies. And thanks to COVID, everybody in the country is talking about nutrition, the various vitamins, the immune systems, and the things that they ought to have taken care of in a disciplined lifestyle, etc., etc. And we are back to recognizing how important the health is. To my left, I have two of my very distinguished, beloved friends and colleagues, Dr. Rishikesh Pai and Basab Mukherjee, who are from our parent organization, Federation of Obstetricians and Gynecologists in India. And we say women's health is nation's wealth because it all begins in utero. When we, from Foxy, declared what is Foxy's CSR? What is Foxy's responsibility for the community? We said it is VSR, value, safety, and respect for each and every human being, especially the women in the country. So taking a cue from that, I would like to start with my first question to the lead on the big canvas, the health of the nation, which so strongly depends on the health of the women in the country. Madan Gopalji from the Niti Aayog, which stands for transformational changes. Madanji, to your mind, how can CSR contribution, which is now mandated by regulations, law, etc., transform the space of public awareness? We are very, very aware of the fact that diseases as long-term NCDs, etc., we need to have a handle on it right now in order not to lose the battle for the next couple of years. So the digital health space, many of these schemes that the government has bought, many public-private partnerships, your impressions and opinions of how much more and how much better can the CSR contributions make to making India better than what it is now. Madanji.
Okay, thank you, Hemaji. Once again, thanks for connecting again after a long time in a physical mode. Otherwise, virtually we were meeting. So one of the important things, why the CSR concept came, because we have to dig down into the history. Philanthropic activity in the country is not new, but it has been formalized in the form of Companies Act in the Section 135 Companies Act, Schedule 7. This public health awareness has been a national priority area, as well as this has been the area of priority which has been described. Having said this, we have been trying to capitalize and motivate the corporates in our activities, public health awareness activities. I will just cite an example where in the National AIDS Control Program, they have a private sector component wherein they try to tap in the CSR resources for awareness generation as well as promoting healthy behavior among the supply chain, not the persons who are covered by the welfare funds of the corporates. They have been in engagement with around more than 400 plus corporates. I will just give you some data points so that you can understand what kind of insights and cooperation these corporates can bring in. Mm-hmm. The second data point is that in our aspirational district program, we have been trying to, we are running around 112 aspirational districts. Why we call aspiration? Because previously the term which was used was higher priority districts or backward district. That doesn't look optimistic. Going forward, we have to say that these districts also aspire to be sitting with the normal district. They want to come up, improve their standards so that they are at par with the normal district. That's why we are saying that they aspire to become this. We are having this 112 aspirational districts. If we improve something in health and nutrition and the other parameters of this district, then we would be able to have our SDG goals met. That's another data point which is happening. Apart from that, during COVID time, you might have seen how the corporates have responded to the call given by the government. Through their disaster funds or through their CSR commitment, they are doing it. You look at the way the vaccine initiative which is happening, one of the private sector NGOs, they are leading that thing. They are trying to see that how to bridge in the gap, because during the initial time when there was supply constraint, you might have seen hesitancy. Here came the role of
The NGOs, with the support of corporates, they have helped it. And now you see that nobody could have imagined. We were receiving calls from people saying that India can't be doing it in 10 years. But in 2 years, we have reached 180 crores that doses have been given. Another aspect which is coming is in the TB program. We had the TB program. Now, how the active case detection can happen, we have demonstrated in one of the aspirational districts with the help of CSR commitments from one of the private sector, saying that how you can, leveraging the CSR funds available, how you can improve the services there, how you can improve the active case detection. There are many examples, but coming back to the original question, how it can contribute to the digital thing, that digital space is also there. In the aspirational district program, when the pandemic lockdown was there 2 years back during the month of March 2020, when the lockdown was enforced and we were dabbling with the issue how to provide services to the comorbid people or the people who are having NCDs, how to provide a follow-up care to them. And telemedicine or telehealth, they were taken seriously by the honorable courts. They have passed orders against doing teleconsultation. It was not legal. So to legalize that, we came up with the telemedicine guidelines, and that has opened a floodgates for doing innovations. And many of the corporates, they have come forward and using this option which is available, they are trying to leverage and they are trying to strengthen the health and wellness centers because there are many divergent issues which are there. I can't be summarizing in 5 or 6 minutes, right. But they are helping the health and wellness center in enabling them doing the teleconsultations. That's a way forward into the digital health. In Ayushman Bharat Health and Wellness Center, that was the second component of this Ayushman Bharat, the first component being the PMJ. So in the PMJ also, that agency which is there, which is now spearheading the implementation of the digital mission, which envisages to digitalize having a patient record. And now the corporates and other people, they are also working and they are trying to bring out their own models, own platform, so as to provide services. Once the telemedicine was open, now you see that so many platforms are there. The biggest challenge, biggest task is how to aggregate them so that we can have a 24/7 telemedicine services available to all the people. We can only say we have opened a floodgate for people, opened a very big market. Now we have to see that how we aggregate so as to provide 24/7 services. It's just general services. Can't we expand it to cover the specialist services? Suppose somebody wants to have an OBG services or mental services, can we provide that mental services through telehealth? If a referral is required, can we connect? That's an area of space where the CSR and these private players, they can come. What has happened, what is the current limitation is after doing consultation, the moment it comes for hospital admission, do we have that kind of leverage to guide that patient and ensure a bed for that patient in that hospital? That's an area where a lot of work is required. So apart from building awareness, digital platform is now open. Now we have to see that how we expand that digital platform so that the vision, objectives of mission to achieve the sustainable development goals has to provide universal health coverage to the citizens of the countries and and it is delivered. Without the help of others, it is our collective responsibility to see that how we take it forward. I will stop
Excellent.
here.
Yeah, excellent. I think there are many important take-home points from Dr. Madan Gopal's inputs, where it's a long journey. This is a complex and a diverse country. But in the wake of COVID, we have fast-forwarded our attempts to digitalize. And also, when we say public awareness, and what next? Because public may be aware, but where do they go and seek help? And how do you strengthen the supply side of quality healthcare and access to healthcare by means of universal coverage? So many dots need to be connected here. Points well taken. And I think anyone, it's my humble suggestion that when aspirational districts, CSR, you want to invest your money for something of a larger good, we must meet and take advice on the gaps that need to be bridged, the initiatives which can make a quick impact, the initiatives which can inspire many more to invest their time, energy, where a small step can make a big difference. Thank you very much, Madan Gopalji. I swing now to Sumana, who is from the Impact Guru Foundation. How one person, a small NGO, in their own little pocket can do mega feats is what Sumana is going to detail, because every step to every individual who is helped on to do better and be better counts. So Sumana, your experience with how you have been shortlisting to put the patients in the center, to put people in the community in the center, create the awareness, pick up some diseases which need your help for taking the treatment further, and everything that you do, the great work that you do around it. Sumana, please.
Thank you, Seema, and good afternoon, everyone. One of the things that we have missed out, I think, in the entire conversations that has been happening is the role of the NGO. You know, just like our ASHA workers, our Anganwadi workers, our foot soldiers, there is the NGO that survives out there, which actually does a lot of community service through the programs that they run across India. And NGOs have actually been in areas where even government hospitals are not prevalent in those areas. Now, what is the role of the NGO? It's not just doing a primary healthcare, but there is awareness. In India, there are many diseases which are curable, which can be stopped at the beginning stages. And how do we do that? We do that through sensitization in our programs. So a healthcare program that we run across India would include always a sensitization program. And not only that, we take data of the patients who come to us, what is the disease pattern? We follow the disease pattern of that area in case we see, like, for example, there's a rise of tuberculosis in a certain area. We will form linkages with the government or other NGOs to say, listen, we are seeing that there is a huge occurrence of tuberculosis in this area. We will call them to come and help out with that disease pattern. Not only that, the disease pattern also, we're able to see what healthcare interventions that we're doing in that area. Is it working or not? Do we need to do more? So there's a think process, a thought process that goes through this whole thing, but most healthcare NGOs on the ground today does a lot of awareness on the ground of nutrition, malnutrition, what things you need to take, what can we do. We keep on drumming it in the heads of the community, keep on educating them over and over and over again, not through just visuals, but also by doing little regional dramas and songs, etc. Make it interesting for them.
Sumana, one very, very quick follow-up question. How do you break the silos within the space of the work that you're doing? With whom do you connect and collaborate to give it a bigger picture, bigger vision to many things which are around health, like it was discussed in the previous panel also, sanitation, education, hygiene, etc., etc. How do you tie up these loose ends within your framework of NGO work?
So we have local people who are known to the community. So the trust factor is built with the community already. We have very close ties with the panchayat and the leaders of the local community who people look up to. So that's the level we start off first, is sensitizing the leaders who the community follow. So that is the biggest step that we take. And we do look at, treating diseases like not only tuberculosis, but we're looking at even diabetes, which is a very big issue. A lot of people in the villages have no clue that they have diabetes, but it is something that can be treated in the preventive part. Then we're also looking at even cataracts. We're looking at, so these are things which actually change the life of an individual. So my humble reach to the corporates is that don't forget the NGOs, don't forget the work we do, support us. Support us, we need your help. Otherwise, the work that the Indian NGOs have done over so many decades will just dry up. And we do need your support in every which way.
Thank you, Sumana. There are people out here who are ready to give their best and do whatever it takes, but we need some steps from the other end too to provide the much needed vitamin M as the corporate social responsibility on the whole, because to get the initiatives going. Vice President of Foxy, Basab Mukherjee. We say, save electricity, save water, save the tigers even, but the campaign today in Foxy is save the uterus. Okay? So that being told, there is so much trust deficit between the public and the medical community as such. Even the routine preventive health care that they need to go, families and women are scared. What will the doctor say? And unnecessarily, they may just suggest some surgeries. So the awareness as to empower the community, the families, the women themselves about the next best steps that they should take. What is the attempt that we as professional organizations need to make? Basab.
Thank you, Dr. Hema. It's a pleasure being here, and it's an inspiration being here among all of you here. So just a couple of words about Foxy before I start. We all represent, Dr. Hema, Dr. Rishi, myself, we all represent the Federation of Obstetricians and Gynecologists of India. It is a 38,000 strong body of gynecologists, making it one of the largest medical organizations of the world, or specialist medical organizations of the world. And among the different academia that we do, public awareness and social activities form a very big component of it. And that's the reason why we are here. We are passionate about public awareness, and we do it in different forms in schools and colleges, in corporate activities across the country. We have 263 societies dotted across the country in different corners of the country. And we do clinical work as well as public awareness and social work. So thank you. So just bringing the context about Preserve the Uterus. This is the campaign which we have started a couple of years ago. Bayer is our partner. So with Bayer, Foxy comes together to Preserve the Uterus campaign, which is a little different from the other women's health activities that we have done. Usually we focus on safe motherhood, anemia, menstrual hygiene, and there are other very sensitive issues. But this is a very specific one where preserve the uterus or try to prevent a hysterectomy if it is not required, which is in many cases across the both medical community as well as the public. So this is a very specific project that we have empowered, where we are trying to bring to the medical community different treatment modalities which are there, which can be used for different patients or women who come to us with problems pertaining to gynecology, where you can do treatment without performing a surgery or an operation. Similarly, in the public, there's very important to sensitize them that a lot of people have the impression that the uterus is mainly for childbearing, and once the birth of the babies are over, then it can be removed, and it's an unnecessary organ, which isn't exactly true. And try also to sensitize them that this is something which you can preserve, and an unnecessary surgery often is not required and may also carry risks of its own. So there's an involvement in the social media. IHW Council is helping us in this regard. They are also partners to this project, and we are happy to have just launched it and the ball started rolling, and we expect to reach to a lot of public and medical community through social media. A lot of stakeholders have also been involved in this, because whenever you want to make a change, policymakers are very important. In Foxy, we do understand that you have to engage with multiple stakeholders to make a difference or to make a mark whenever you want to engage in a project. So it's not just about talking awareness, but behavioral change takes time, and we understand that to make a mark, you really need to engage with several policy makers and lobbying at different levels, and we are involved in that. Thank you, Dr.
Thank you, Basab. As we speak, Dr. Archana Verma, who is currently the Vice President of Foxy, but she was heading a committee called Committee for Public Awareness, because we have a huge network of champions across the country who have taken up the issues, as Sumana said, to sensitize the girls, women, communities, families, for them to know the facts and dispel the myths. So Deepak ji, when Bayer, came up with this concept, they have many portfolios to manage. Their CSR funds, of course, can be given for, we are aware that nutrition and there are certain other major areas where they are supporting not only the professional organizations, but also the other network. So what is your thought process on how the CSR funds from Bayer can be well invested for public awareness and diseases? Deepak ji.
Yeah, thank you, Dr. Hema. And good afternoon all. Very happy to represent Bayer. And I will just be a bit specific on CSR activities, what we term as CSE, that is corporate social engagement within Bayer. So apart from CSR, we feel that the sustainability part of CSR is much bigger than CSR in itself, because sustainability kind of generates a lot of business opportunities, which actually leads to growth. And in the afternoon also, we were discussing, if a corporate grows and if there is growth financially, there are profits, probably the advantage reaches to the communities at large. So our vision is health for all and hunger for none. Bayer being a life science company, we are not a typical pharma company. So we are into crop science also, and of course into healthcare as well. So, okay, fine. So this slide would give some specifics. So I'm not going and really reading the content of the slide, but just to give you a brief outcome of what we actually think, prioritize, and execute. So globally, where India is also a very important part, as I mentioned, that our vision is driven by science for better life. So we are into food security, increasing the food grain and increasing the food security globally. We are into improving the health of mankind, and of course doing it in a very environment friendly manner by reducing our carbon footprint. So this is all we do. And in next 10 years or by 2030, like we are committed as a part of UN SDGs to kind of improve the lives of 100 million small stake farmers. And when I say so, just a small data point, there are around 550 million small stakeholder farmers across the globe who contribute to close to 80% of the food supplies. And still they remain as poor, and they're not able to get meals for their families. So we are committed to that. Apart from that, women's healthcare area, where we are global leaders. So we are empowering women. We are making them more stronger, and kind of accessing modern contraceptives so that they can make their own choices. So that, because as the belief is gender equality is very decisive in making social and economical development and growth across the globe. So this is what we are committed to, and India is also a very important part. And apart from that, we are also kind of improving self-care for more than 100 million people across the globe. So this is what we do globally. And as I mentioned, India being a very large country with a very large population, So this thought came to us, and many of you must be aware of, there were national media article where, the rate of hysterectomies were quite high in India, and as high to 26, 27 in some states. And the most, sad part was the median age of the hysterectomies happening in India is close to 34 years, which is 10 years lesser than the global average. And like what Dr. Basab also mentioned, so the role of uterus is not just, giving birth to babies, but much larger and across the life of the female. Yeah. So we don't remove an eye in case we have some trouble or some kind of a problem with our eye. So similarly, if a lady or a family is complete, we don't just think that the root cause or the uterus is the root cause of many diseases. So it has to be preserved. So this program we started, we signed a MOU with Foxy. Foxy has been our very strong and very trustful partners. So what we are planning is to again collaborate. We have our PR agency and media partners in IHW. So we look forward to partner with multiple NGOs, corporates, groups, so that we are able to take it as far. India being a very large country, because we alone as Bayer won't be able to do that. So we are looking forward, and it can be your program. It can be, it can sit in your program. We will be just sitting behind in the background and giving you some format and some framework, so that it is not that the Bayer cross has to be there. Bayer cross can be pulled out of. So my request and appeal to each one of you will, in case it interests you, it appeals you, so probably we can strongly collaborate and move forward. So this is what Bayer is doing as far as CSR is concerned.
Thank you, Deepakji. You said millions of people. So the scale of reach and the vision of Bayer is really big. And I think together we can and we will. That's our promise. And as how it was alluded to in the very first panel moderated by Kamalji, that, everybody just wants to have their logos here and there. That's not important. Bayer is open for any one of us to collaborate and get the needle moving forward. So we pledge on the public forum here that, yes, we are together in this. Now, Uttar Pradesh, where really many transformational initiatives have been taken. And once upon a time, it was not expected that Uttar Pradesh would do so very well. And it has proven to us that where there is a will, there is a way. Otherwise, there are only excuses. So from a large institute in Uttar Pradesh, Rakeshji, we know that thousands of patients come and throng in your setup. I just want to ask you two little questions. One is that just because of the sheer volumes, how do you think investing on delivering quality care would really be crucial, so that whoever comes there, is the justice is done? That is one prong of the awareness translating into the universality of good quality care. And secondly, what would be your ask from anybody from the CSR funds if they want to invest in your setting? Where would you put the money in?
I think, thank you. Thank you, Dr. Hema, and thank you, Integrated Health and Wellness Council, for giving us the opportunity to participate in this great forum. I rarely see much government institutions, but I am happy to be here. Actually, CSR actually has made a big impact. If I see my last 2 years of tenure in GIMS Greater Noida, where during second wave, we had barely capacity of 200 beds, almost 100% occupancy. And then that was the time we realized there is a definite need. And I wanted to put it on record, the role of CSR by HCL Foundation and Doctors for You. And overnight, we have made from 200 beds to 500 beds. And we could manage more than 350 to 400 patients at one time. And because of that, we managed more than 5,000 patients and with a minimum case fatality. So I think this was a huge impact of CSR on our health, or you can say that disease. And for the GIMS actually has been awarded the best institute in the entire Uttar Pradesh in terms of maximum patients, maximum research, and the best innovations. So I think major credit goes to CSR activity, which we could get it, and we could convert this into, saving precious lives.
Beyond the COVID times and beyond what you have already got, there are
Yes.
so many here. They want
So
to give
this
you
is
more.
one- so this
So
is one
what would
actually
you
wanted.
invest that on?
See, all the government, if you see the spending of on the healthcare investment of the government, it is still highly inadequate. Pre-COVID, we are having some 1 to 1.3% of total GDP. Now, during COVID, there was a huge increase, but still we are at 2.1 or 2.3. Dr. Madan Gopal can correct me. It is much, much less as compared to the Western countries. USA, we are almost reaching 19%. It's a huge. So there's a huge gap between what actually we are getting in the healthcare sector and what is actually the desired. And this gap actually is not fulfilled, but definitely it can be minimized by the corporate social responsibility. So I think there's a huge, before 2 years, we were hardly knowing this CSR on papers. Now actually we are making it happen, and this is really converting into our, actual patient care, or the output has been actually increased. So what we need, it is not only giving. There was, in fact, at one time there's a problem of plenty. We are doing a lot of CSR thing which is actually not required, which is still, lying and not highly underutilized, especially oxygen and other things. So there has to be a match between demand and supply. So it is not only for that. Probably when we say awareness, I take it other way. All corporate should be made aware of the actual problems, what actually the poor people or through NGOs, what the government institutions actually are facing, and then only they should invest it. Secondly, they should not investment in terms of money. It should be in terms of kind, which is actually required. Like we got a huge, oxygen plants, 4 oxygen plants. Now we are converting, we are made it, we are filling cylinders and we are supplying to the all, other hospitals. We can increase the oxygen beds. We can increase the ICU beds. So there are various things. We got 4 ambulances now. We have started ambulance for the poor patients at no profit. So a lot of things actually, demand supply need to be mismatched, and which can be actually resulting into various benefit to the patient. And secondly, what you said, in our own institute, what we made it, we are actually investing a lot of things on women and child. For the children, I myself as a pediatrician, we have made all immunization free for all girls. America, you only boys will pay, but all girls it will be free. We have put a mammography machine. We are again doing a lot of screening for the, women, for the cancer screening for the. So that is what we are doing. But if we get support from probably NGOs and corporate, probably I think government sector one should invest so that your money is actually going to the real needy people. So I think I wanted to thank again ISW for this opportunity, and thank you very much.
Thank you, Rakesh ji. Well said and well done. I think, this is a very demonstrative model, which, if others get, you said it's a problem of plenty. There are so many people giving so much money, but how you have utilized it for, really making an impact, and how you have continuously scaled up the impact is really, really very impressive. Last but not the least, the one who has been waiting very, very patiently to my left, Dr. Rishikesh Pai. He is going to be stepping into the prestigious post of the president of our federation in just about 3 months' time. And many times when we talk to Rishikesh, he says, there are lots of funds we can get from CSR. We have to get it for our organization, and we have to do something really big. Rishi, what is your ask, and what do you want to do with the capacity that the federation has, the technical expertise that we have, the enthusiasm of the champions within our own settings, the connect and collaborate philosophy, which I'm thankful to both of you for being here to spare your valuable time to soak into what is happening around us and imbibe the best. So what would you think would be the best for us to do as a professional organization with the CSR, both for public awareness, for diseases, care, and prevention as well? Rishikesh.
Thank you, Hema. First of all, I would like to appreciate Hema Divakar And Kamal Narayan, I've seen him up in person, IHW, Himani, and all the team of IHW. Please give them a big hand. It's a wonderful organization. And that's the whole healthcare. No, my dad was a preventive public health man from Harvard. Started the internship program movement. He started a department in KM Hospital. And I've been grown in public health. When I finished my MBBS, I wanted to become a public health person. My father said, "Are you mad? There's no money in public health. Please become a gynecologist, make the money and then do public health." That was the situation then. Now things have changed. What you see here is the whole broad spectrum of healthcare delivery system. We have the corporate, we have the visionary, Madan, who is from the government. We have the private organizations, we have the NGOs, and we have the private hospitals. So there is the government hospitals, and there's a private hospitals are there sitting in the. So there is a lot of people who are actually delivering the healthcare system. The problem is that we don't know each other. That's the biggest problem. Look at the NHFI, fantastic progress by the government. Sex ratio has improved, education, sanitization, electrification, everything is damn good. NRR has gone to 2. So we are doing very well, but we can do massively well only if we connect the dots. We need you, them, us to be together. We don't know each other at all. When I was seeing NDTV program on some Swasthya woman something, Federation is not involved. What is Reckitt doing? We are the custodians of women's health, 40,000 people. We have total disconnect in this country. Total disconnect. There's no alignment at all. So our energies get wasted. Kamalji, most important thing you need to do is digitization. Create the platform where all these people are hosted. What is everyone doing? Someone is doing tuberculosis. Someone is doing contraception. Cluster them. Let them talk to each other. Get the CSR funding as an integrated funding. Then only we'll make the change, a rapid change. We need a rapid change. Our neonatal mortality, if you look at the Kerala, it is 2.9 and all India is 30, 29 point something. We need rapid change. That can happen if we do it. We can't do it the slow way. No, the country is 70 years old. We need the fast way. We need the NGOs to integrate with the organization. So this is very important part of how we evolve ourselves in the future. I always classify CSR into 3 parts. There is the CSR, there is the GSR, government. Huge amount of funding. Just give it to everyone. Why are we going after the corporates? Government is the largest corporate. Government has to have faith in other NGOs. They need to say, okay, here is 10,000 crores. Do your work. Don't look for the money. We will give you the money. That's very important. And of course, the last type of CSR is ISR, individual social. This is the ultimate vision. My brother-in-law is in United States. Says, what Indians, you are useless. You don't have any. Every Catholic gives lot of money. Donation they give in the church. How many Hindus give it? We need to donate. Individual social responsibility. That's how the corpus will be created to propel our country to the next stage. We are already fantastic. So federation is, my concept is Badlao concept. Integrate everything into one aspect. There are 9-10 aspects of women's health. All will be integrated. We already have. Hema leads the best, one of the best CSRs. That is our Manyata program. It is funded by Makata Foundation and MSD for Mothers. Fantastic. We have upgraded 1,500 nursing homes, but we need more of them. So what I'm saying, Hema, is that we need to have more interactive. Madan ji, aap idhar hai. आप जरा बोलिए उनको बड़े साहब को कि it's more important to integrate the vectors, align the vectors so we have fantastic action out of it. Thank you.
Thank you, Rishikesh. In the next 5 minutes, we're closing this panel with the closing comments on challenges and opportunities, the 2 sides of the coin, starting with Madanji, of course.
One of the challenges is the trust. trust between the corporates and the NGOs. Over the years, it has come down. You see most of the corporates going for foundations. That's the question. Then we have to introspecting why these foundations have been coming up. They want to do their own work. When the corporates, they are not trusting the civil society, then we have to find an answer to that. It's not that connect between the beneficiaries and the system. Right. Government do have a system. That system, though may be fragmented, jaisa bhi hai, but system is there. Right. The moment it comes to private sector, of below the district level, there is no system. So we have to see that how we leverage on the system and provide services. Second thing, for tapping the CSR resources, one of the important thing is you should have a proposal and you have to see that what kind of value addition you are having. Right. That value addition is not being seen. They want to just see that how they can sustain their business. If value addition is not there, even the government proposals, they will say yes, but they will not fund. Because value addition should be there. It cannot be that I have seen a lot of pumping in the form of equipments, everything, but without having any know-how, without having capacities, what Absolutely. This equipment will do in the government system. No, because this is a way of absorbing things, but you have to find out what kind of mechanism is there. You just take the example of oxygen concentrators. When the government has been providing oxygen concentrator right up to a health and wellness center, that means around 170,000 health and wellness centers are there. We have been able to supply that. Triacade GPS tracking is there. Apart from that, CSR also have given this without having a accountability mechanism where this oxygen concentrators will go. For the oxygen concentrator, which we have been supplied through the public system, we can track. GPS tracker is there. The functionality, a team is going nowadays to have to monitor that whether it is functioning or not. But similarly, many oxygen concentrators were supplied by the CSR commitment where they have all gone. We have to see that how the trust between the corporates and the public, it improves. That's the area where we need to work. That's the biggest challenge. And we see that how we address this biggest challenge. And we have to find out what kind of value we bring in by partnering with the public sector and the government agency. That's the only challenge which I'm seeing.
Excellent. I think, this is a good closing because there is a lot being done, and fragmentation is not a word that we use loosely, but we actually mean that we have to just get things together, glued together, and one step at a time make an impact. So my yes or no answer from all the other, like a rapid fire, I want integrated health and well-being centers. Number of them was the vision of the government, Madanji. Each of them, the capacity is built and actually prevent illness and promote wellness. Can we get our act together to do it? For example, many clusters of IHW, which also incidentally is the Integrated and Health Wellbeing Council as we speak, the same IHW concept in the wellness centers. Can we have a cluster networking with your government hospital so that the primary is done there and only the bottlenecking in your own setting would be then minimized, with us supporting the capacity building for quality care in those? Yes or no?
No, definitely, madam. This is the need. I think I agree with Dr. Rishikesh. First, we have to integrate ourselves.
Yeah.
And this is a forum where everyone is here, right from government till private, CSR, NGOs. So we need to integrate, and this is the right forum where we all can integrate it. Sure. And then only the demand supply can, match. So we can, decrease the gap by integration. This is one definitely. And secondly, day before I was very fascinated with PM's Panchamrit. So I think we have to follow the principle of we have to reach to the right people. We have to reform. We have to regulate. We have to revolutionize. And we have to respond. And I also added, we need to have a research and we need to find out the actual need, because India is something, so much, diverse. The needs are different in the same cities. So it is not the same thing can be go to everywhere. So we need to do a lot of investment in the research. So that also is required. And of course, the digital health And telemedicine, again, we can boost up, which can definitely improve the health.
Thank you very much, because implementation research is, one of the key factors for us to learn our lessons and move ahead.
I just wanted to put in when you asked about challenges faced,
yes.
Okay. So I'm speaking in perspective of an NGO. I think one of the biggest challenges that we faced is the ever-changing laws and rules of CSR. By the time we take in a breath of a new law, something else happens. And then there are gray areas to the law. We're not getting enough time to understand. And then again, there's another change. We need to do the work we're doing for what we are here for. So my humble, this thing to anybody who's here from the government, give us time to breathe. Give us time to do the work we are here to do. And the second challenge, like when we are all talking about digital medicine and e-health and all that, most of the villages don't even have internet connections. First of all, we need to get technology up there. A lot of our disadvantaged beneficiaries, they don't even have smartphones. They don't have access to the computer. These are steps we need to first cover before we can even get digital health to the doorstep of our beneficiaries. So these are the two challenges that I see. Ever-changing laws and rules. And
on a positive note, everybody has that intent of reaching the technology to the last mile, and I think we are moving several steps ahead. I want to ask Basab about the challenge of gender inequity. How much the women are empowered to make decisions for their own body, mind, and soul.
Yeah, thank you, Dr. Hema. I think that's a challenge which we all face. I think gender inequality and gender neutrality is a big challenge in the healthcare sector. I think a lot of women in our country are unfortunately unable to make decisions of health on their own, and a lot of families involved. This is a challenge which we face when we talk to them about counseling in different perspectives across the fields of obstetrics and gynecology, women health care. So that's something which we also factor into the discussion whenever we are talking to them or trying to bring into some new concept to them. It has to be done through the family in many cases, because a woman may not always be an independent decision maker. So I agree with you. So I think the slogan which I would like to leave is plan fast, but act faster. I think that would be for everybody.
Good. Deepakji, Bayer has invested a lot in our world organization called FIGO on the nutritional aspect. And here you are speaking about collaborating with Foxy for Save the Uterus. How much do you trust us?
So as I mentioned earlier also, like Foxy has been a very trustful, very strong partner to us, not only for this project of Preserve the Uterus, but it has been decades now. So every year we keep on working on academics, generating a lot of guidelines, protocols, maybe endometriosis, PCOS, all the gynecological areas we have been doing that. You are aware of that, ma'am. So I think one of the biggest and most trusted partners, of course. And just to, like what Mr. Madan was also mentioning, so coming from corporate probably gives us, that kind of a thought that all CSR activities probably should have key performance indicators, so that it is measurable and the loops can be closed. Hence, I think what Dr. Pai was also mentioning, integrated approach, probably that will help us.
Yeah. So the last word again from Dr. Rishikesh Pai, the key deliverables given a lot of CSR money during your term.
So I am actually having the Badlao campaign, which will start as, we have my tenure is for 1 year. So we'll have the 12 main things. So starting from teen care, then we have the respectful maternal care, then your Save the Uterus campaign, then we have the vaccinations, the infection part, cancer screening, and mainly the Badlao will be the NCDs, because the government is doing a fantastic work. You'll be surprised that the Suman campaign of the government has revolutionized the SDG goals, and so the government is already targeting the 800 million people. The problem is with the 200 million middle class, which can't go to the government hospital. You can't share a toilet with someone. It's so very difficult to do. So the middle class is the one which is jammed. My campaign is targeted to that 200 million middle class, which is now has evolved to the NCD stage. Anemia is not there, but cancer screening, diabetes, hypertension, mental health, these are the areas which we will be focusing on and supporting the government's. For your information, the PMSMA campaign was launched during when I was Secretary General of Federation in 2016 with the IMA and the Pradhan Mantri Surakshit Matrutva Abhiyan. So I hope that I can do the 18th of every month, everyone, all the gynecologists will do free checkup in their consulting room, because government doesn't like camp concept. You must give the respect to the poor person in their own consulting. You have to treat them like you are treating another patient. So 18th of every month will be the badlav. You can walk into any consulting room of the gynecologist and he will do a free checkup on 18th of every, just like we do a free checkup of 9th of every month for antenatal care, non-antenatal. And hopefully I will showcase this during my tenure, and hopefully the Pradhan Mantri will take it up and call it Pradhan Mantri Badlav Abhiyan. That is my objective.
Thank you. I think Badlav, the change is a constant, and disruption is a key word in this new era. And I must confess that when we had a short meeting in the meeting room just 5 minutes before we started this panel, my thoughts were heavily disrupted, with each one giving very, very many different inputs, and each one of them must have thought in their own minds, what are we going to do in this panel? I do hope, ladies and gentlemen, that we have done some justice. This is the meeting of unlike minds. We have come together to put all the thoughts as the pieces of a jigsaw puzzle to lead the country to the pink of its health in a very prosperous way. Thank you very, very much for your kind attention, and thank you, Kamalji, for the wonderful opportunity with such a galaxy of brilliant panelists. Thank you. Thank you.
Big round of applause for our speakers on stage. Thank you, Hima ma'am. Thank you, Dr. K. Matan Gopal, Dr. Rakesh Gupta, Dr. Rishikesh Pai, Mr. Deepak Chopra, Dr. Basav Mukherjee, and Ms. Sumana Bhasin for a very interesting discussion. Thank you all for taking the time here and talking about public health being an important part of CSR initiatives. Thank you. We're extremely grateful to our esteemed jury members for the time and the effort they have taken. I'm sure they have amplified the cause by lending their support to it. On behalf of IHW Council, I would like to thank all our jury members for their time and their effort to the 6th edition of the CSR Health Impact Awards. Now, very soon we will have our awards, but I would like to take this opportunity to thank our esteemed jury members who have devoted a lot of the time and energy to select the winning entries. So a quick introduction of all our jury members, and I would request Kamal Narayan to please come on stage to felicitate the jury members who are present here with us. An introduction of our jury, Mr. Ram Bandyopadhyay, IAS, former Secretary, Ministry of Corporate Affairs, Government of India. Mr. Alok Ranjan, IAS, former Chief Secretary, Government of Uttar Pradesh. Mr. Shiv Khera, author, educator, business consultant, and a much sought after speaker. Mr. Matthew Chevin, Board Chairperson, Care India. Dr. Ranjana Kumari, Director, Center for Social Research. Dr. Farhat Mantu, General Director, MSF South Asia. Mr. Vijay Sethi, Digital Transformation and Sustainability Evangelist. Dr. Chandrakant Pandav, Public Health Expert. And Ms. Shelly Chopra, founder, SheThePeople.tv. Now I would request Mr. Kamal Narayan to please come on stage and felicitate our jury members with mementos. I would request Mr. Vijay Sethi to please come on stage to receive his memento. I would request Dr. Farhat Mantu, General Director, MSF South Asia, to please come on stage to receive a memento. Grateful to our other esteemed jury members who are not here, but our heartfelt thanks to them. Thank you, Kamal, for giving away the mementos. Right now, we'll take a short break of about 20-25 minutes, and we will then come back with the most awaited CSR Health Impact Awards. So do join us again.